November 17th, 2020. I'm going to call the meeting to order. And Clerk of the Board, could you conduct roll call?
Absolutely. Supervisor Brown?
Present.
Supervisor McCowan?
Here.
Chair Haschak?
Here.
Supervisor Jody?
Here.
And Supervisor Williams?
Here.
Thank you. Good morning.
All right, and I'm going to see if Rose Britton is on to lead us in the Pledge of Allegiance.
Chair Haschak, we don't have Rose for the Pledge of Allegiance right now.
Okay, then I'll lead it. Okay. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, it's a nice rainy day in Mendocino County, so we're very appreciative of that. And I'd just like to say that we're a little short-staffed in the Clerk of the Board's office. So we're doing the best we can technologically today. So it will work out. And in order to speak via telecomment, one must submit a speaker form online before 8 a.m. the day of the meeting. The link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website under Agenda and Minutes and Public Engagement. If you have submitted a telecomment request for either public expression or consent calendar, please call in now. Okay. And do we have anyone for public expression?
Yes, we do, Chair Haschak. We have Katrina Bartlemay and Katie Ford on the line.
Okay, so Katrina Bartlemay, Registrar of Voters. Would you like to give us some update on the election?
Sure. Can you hear me?
Yes.
Okay. I don't have video either. Might as well get video. So we're processing our provisionals now. We've opened and have got everything ready, all the absentees ready to count. We counted an additional 11,000 by Friday. So we released those updated results. We've got about 1,800 between the first or the same day registration and the provisional ballots that we're processing now. We're about halfway through with that. And then we'll be able to remake them to the proper precincts where we need to. So right now, with our update, we counted 36,586 ballots for 68.19% turnout. And then we had an original about 17,000 ballots left to count from election night. So I'm thinking that our turnout is probably going to be 75 to 78% turnout, which back in 2008, we had an 80% turnout. So, you know, and if we were able to count every single one, we'd have an 80% turnout now, but we're gonna fall short of that 80%, I believe.
Okay, very good. And all's going well.
All's going well. We're working our little fingers to the bone. This is the first weekend that we took off this last weekend since the beginning of October. So we were thrilled to not have to go anywhere over the weekend. You know, we're back at it and going towards it. We hope to have the provisionals done by today's Tuesday, by Wednesday afternoon or Thursday morning, and then we can start doing those and start back at counting the ballots that we have left to count, and then the provisionals, and then we get to count our unused, and we've got a lot of work to do before we can actually certify the results. We're hoping to get that done the week of Thanksgiving, but it may not happen until the following week. We have 30 days to certify. So with this many ballots, it's taken us a long time to do that.
Well, again, on behalf of the board, we appreciate all the work you and your team and all the volunteers have done.
Yeah, we have a great team. We have great extra help people. We started out with 4 extra help people the beginning of October because we were just inundated with phone calls and we couldn't get any work done. And then it built up to 8. Today we have 4 people in there working, and by Thursday, all 8 of them will be back doing the provisional. So, we just have to have time to do everything we have to do in order to provide the results. So we're there. Everyone, extra help has been wonderful. Our poll workers were tremendous. We had a couple little incidents at our polling places where people did not want to wear masks. 99.9% of them were very compliant, were very good with wearing masks and following public health guidelines. But, we had a couple, but overall, I think everything went well. Our poll workers did a tremendous job trying to keep everything. It's so hard to plan for anything that we're not sure what's going to happen. It wasn't a normal election. And boy, they were right there with us, helping us every step of the way. So you couldn't have asked for better people.
All right, very good. Okay, thank you very much.
Thank you.
Keep up the good work.
Thanks. You too.
Okay, as for public expression, I would like to recognize that the California State Association of Counties, CSAC, has announced the recipients of its 2020 Challenge Awards, spotlighting the most innovative programs developed and implemented by California counties. The Mendocino County Emergency Call Center received a CSAC Merit Award within the Disaster Emergency Response category and was among 49 programs recently honored at the 2020 CSAC conference. The call center program has proven to be efficient and versatile in responding to the ever-changing needs of emergency response. We would like to recognize the Executive Office and Sheriff's Office for their collaboration in the creation of an award-winning, innovative, and adaptable emergency call center capable of addressing all facets of call center emergency response. We have 2 of the people who really helped get this rolling, Rose Britton and Katie Ford. And so are Rose and Katie available?
Yes, good morning.
Good morning. So we just wanted to recognize the good work that you have done on behalf of the county for all the emergencies dating back to 2017 and getting the call center up and running for the epidemic, for the disasters, for the fires. So it's recognized statewide, and we really appreciate that.
Thank you, Supervisor Haschuk and the Board of Supervisors for allowing me the honor to speak today and to speak just a second about this program. It was an honor for me to work with KDS Ford and the county under direction of Carmel Angelo and Sheriff Kendall to develop the program. The program was developed out of the need from the 2017 fires that devastated us in our county. And so a need for better response in the call center and closing the loop as we speak. So thank you for the honor to speak today. I'm very honored, and thank you, Katie, for working with me. Thanks, Board and Sheriff Kendall and Carmel.
All right, well, thank you. Is Katie on the line?
Yes, hello. So my name is Katie Ford, Human Resources Analyst. Good morning, Chair Haschuk, members of the board, CEO Angelo. I also just wanted to thank the Executive Office and the Sheriff's Office, along with my own department, Human Resources, for fostering collaboration across department lines, which gave us the opportunity to work on creating an adaptable call center that could respond to the needs of, as it turns out, COVID, but also fires, floods, earthquakes, And I just wanted to point out, I think a lot of people aren't aware that we did this using software that cost the county less than $40. And that innovation, I think, is part of what piqued CSAC, California State Association of Counties, attention in this. But it's proven to be adaptable to the needs of COVID. It was initially created with more conventional disasters in mind. It certainly provides information valuable to the sheriff's office to perform their duties behind evacuation lines. And so I just wanted to share my gratitude for allowing us the opportunity to serve our community this way and giving us the time to do so.
Okay, thank you. And we, CEO Angela would like to speak.
Chair Haschak, thank you. I as well, of course, want to thank the sheriff for his partnership. As this board knows, and under the direction of this board, the Office of Emergency Services is a shared responsibility between the executive office and the sheriff. And Sheriff Kendall has been a consummate partner as we've worked through not only fires, but the pandemic. So I do want to recognize that. He has allowed Rose Britton to work tirelessly with Katie Ford on this project. I would also like to recognize not only Rose, but Katie, in that the CSAC awards that we have received over the last few years have come out of human resources. Katie Ford is one of the most creative employees we have. And along with Rose, they have put together an exemplary call center. And again, the other CSAC awards that we have gotten have come from Katie's good work in human resources. So again, thank you to our team, thank you to the sheriff, and certainly Chair Haschak to the work of this board with your leadership through CSAC. Thank you.
Okay, thank you.
Mr. Chair.
Yes, Supervisor Brown.
Thank you, sir. I just wanted to echo your praise and let county staff know how proud we are of them. Appreciate all their hard work. Thank you.
All right, very good. And speaking of Supervisor Brown, the California State Association of Counties also recognized Supervisor Brown with a Circle of Service Award for her commitment, energy, and leadership in representing Mendocino County at the state level. And certainly Supervisor Brown has so many connections at the state level that have helped us through innumerable issues. Certainly in this latest pandemic with the COVID response, her voice is very well heard throughout the rural counties. And I was on a conference call of the rural counties the other day, and there's Supervisor Brown making the motion to bring forth an item that's important to all of us. So Supervisor Brown, you're recognized for your exemplary work and years of commitment.
Thank you, sir. It was a real honor. I was one of 3 selected for this year's award, and it was a surprise, but it was very much an honor. Thank you.
Very good. Okay. Moving on to the consent calendar. Okay, agenda item number 4. Okay. Are there any items that need to be pulled or for comment or question?
Mr. Chair?
Yes.
I would just like to comment on 4A when appropriate.
Okay.
And Mr. Chair, I will have comment on a couple of items, but we don't need to pull them. Thank you.
Okay. And I was going to comment on 4P and 4Y. And I was going to pull item 4Y. Okay, anyone else? Okay, Supervisor Brown, item 4A.
Yes, sir, and thank you. I just want to thank all our people that have stepped up for these appointments in lieu of election. It was extremely important for each one of these districts. to have a full board. So I just wanted to say thank you to everyone who's listed on those appointments throughout the county, different districts throughout the county. So that's my comment on 4A. Thank you.
Okay. On 4P, I'd just like to say that this is a contract for Nuestra Alianza to create the Promotores de Salud program. I'm very proud. Nuestra Alianza is a group of Latinx people, mostly in Willits, but they will be doing the work in Ukiah. Some of the people who are going to be leading this program are former students of mine, so very proud to get that going. And I think it will be great for education and promoting appropriate behavior and healthy health tips in this COVID environment. So we look forward to the good work that Nuestra Alianza will be doing. Okay. Item 4Y is for the equity grant. And I just had some questions about the cost for it. You know, it seems like this contract for $211,000, and I see that every hour spent is charged at $160 an hour, even if it seems like it's pretty much standard office work. So I'm just, I have a question about the appropriateness of that. So we can, if we can hold that off, I don't know if Planning and Building, if Megan Duquette or Brent Schultz are on the line, but maybe they can answer that.
Mr. Chair.
Yes, Supervisor McCowan.
Thank you. I believe you indicated you would be pulling item 4Y for separate discussion.
Right.
Or do you just have questions?
Well, I guess it's for a separate discussion because I want those
okay.
questions.
All right. So I had indicated I did have a comment on a couple of items. They don't need to be pulled. I just wanted to comment.
Okay, go ahead.
Thank you. And I will second your comments with item 4P, the contract with Nuestra Alianza for a 6-month pilot program for a Promotores de Salud model that we certainly hope will help educate people about what is required to respond appropriately to the pandemic in an effort to get our case numbers down. More importantly, I think, depending on the success of this pilot program, it really shows the way for an ongoing program that will help Mendocino County address the health inequities that have been brought to the forefront with the pandemic, but which we know have existed all along. So along with you, I congratulate Nuestra Alianza for stepping up to take this on and certainly wish them all the success in the world. I also wanted to note on the agenda, item 4O is the ratification of submission of a grant application for up to $5.4 million through the California Department of Housing and Community Development for an emergency solutions grant. This would be funded by the CARES Act and would be to provide further assistance to individuals who are experiencing homelessness or at risk of homelessness. And again, it shows the commitment of the state to address homelessness issues. I know it's proven controversial with some people, but you cannot both complain about seeing homeless people walking the streets of our communities and then deny the need for services to get them off the street and into appropriate housing where they can begin working on their other underlying problems. So obviously, we all fully support this grant application. Thank you.
Okay, and So we have Planning and Building Services on the line. So if they could answer some questions.
Hello, Chair Hashik and board members, and County Council Curtis and CEO Angela. This is Brent Schultz, Planning and Building Services Director. And I believe we can also have Megan speak to this item. I reviewed all the submittals on this item that came into us for a request for proposals. This is a very complex grant program. Our criteria that we have to go through, I believe, requires us to have a quality firm to help us administer this. We're not deep in our cannabis program with administrative staff and other help that we need to process these grants when we start them. I think starting in December, probably, January timeframe is what Megan's talking about. This firm is highly qualified. They are doing the Cannabis Equity Grant Program for other jurisdictions right now. We want to hit the ground running. I can't do it without this firm. I think it's not just administrative tasks they're going to be doing, but helping us do the eligibility and getting people queued up so we can get these grants rolling quickly. So with that, I'd recommend the board approve this. Let us get them on board to help Megan get this program moving. And also, Megan, do you have anything else you'd like to add about this firm?
This is through the chair. This is Megan Duquette.
Yes, go ahead.
Megan Duquette, Senior Program Manager with the Cannabis Division. Good morning, board. I would just emphasize that it's really important that and critical that with the contract being approved today, we can really hit the ground running, as Director Schultz mentioned.
Mr. Chair.
All of
Mr. Chair, Megan.
And they are highly qualified.
Excuse me, Megan.
Yes.
Can you move closer to a microphone, please? We're having a very hard time hearing you. Thank you.
Yes, sorry about that. So Core Partners is very highly qualified. They are managing other jurisdictions grant programs, like
the
Dr.
sound is
mentioned. One of them is the county of Oakland, the city of Oakland, as well as the city of Los Angeles and the city of Sacramento. We believe that they would be very helpful in the process of not only managing the grant, but assisting us with getting this application process, and as well as the eligibility applications on an online portal. They have the ability to do that, as well as legal counsel to assist us with grant agreements and contractual items. So I think it's really important that we move forward with this contract.
Chair Haschak?
Yes, Supervisor Williams.
I have a question. The Cannabis Equity Program is about assisting cultivators engage in the legal market. It provides assistance to get cultivators through our county permitting process. So the question is for Brent Schultz. In other counties, I see that the county permit provides documentation that allows a cultivator to get a state license. In our county, a cultivator going through our whole permitting process isn't any closer to a state license than before they start our process. So it looks to me like we're using the cannabis equity funds on a dead-end path. And it's really hard to talk about this item without talking about the big picture of how are we spending the money. Do you have anyone on your staff, given that you oversee the cannabis program, who believes that our county permitting process will get cultivators a state annual license by the deadline a year from now?
Chair Haschak, if I could answer that. Brent Schultz, Planning and Building Services Director. So if I could paraphrase what you're saying is, does our ministerial permit process right now, will it, if they meet every condition in that ministerial ordinance, basically all the measures that are in our MND, which are in our ordinance, if they hit all that, and provide everything to us, will they get an annual license just off our ministerial ordinance? Is that the question?
Using these equity dollars to get the cultivator through our county permit, will they be any closer to a state license?
No,
So
they will not.
So this is, I support the item. I mean,
however, Supervisor Williams, if I could bring up one point, it is written broadly so that if there are those who go through our discretionary ordinance, that we can help them with their discretionary ordinance fees and charges and costs, as well as there's many other things. It's been written very broadly. So I do believe it's important to get Megan the staff she needs and be ready to go, because there's a time limit on this money that we have to get it spent. So, and we are working on the new cannabis ordinance, and when that goes in place, or our coastal cannabis ordinance, if that one is a discretionary use-based ordinance, when that goes in place, people that qualify for this grant may, we could help them get through the process with a discretionary ordinance, because we can get them their site-specific CEQA analysis and a notice of determination or exemption to CDFA, and they have to give them an annual license. Now, if they qualify with state licensing requirements too,
Okay.
right?
Maybe we should just keep this to the equity grant aspect.
Oh, I'm sorry, but the equity.
So Chair Haschak, I support this item, and you were talking about awards this morning. I would say Megan Duquette deserves an award for persevering through an impossible process, and this is just one more leg of that. I support the item because we need to move forward. We need to spend the dollars, but I do have a concern that we're throwing good money after bad money. We're continuing to spend down a path that is a dead end.
Yeah, and my concern was just not that we don't need this, or it could be problematic, but that I can understand for legal counsel, for the program manager, $160 an hour, but when we get into the application reviewer, some of those tasks, it just seems like straight $160 per hour across the board for all of these expenses or tasks, and it just seems maybe a little overinflated cost. But with that said, I'll leave it. Okay, any other comments on that?
Mr. Chair.
Supervisor McCowan.
Thank you. Well, I agree that we do need to move forward with this. I think you raise valid points. Supervisor Williams raises a valid concern, but I don't see anything to be gained by further delay in implementing the equity program grant. Originally, I think the target date, we were hopeful we might start pushing this money out as early as July. I totally agree. We don't want to push it out to people that are destined to fail. And without going into the discussion, it just underlines the need to have a functional path forward, which we don't currently have. And I think Director Schultz alluded to a discretionary ordinance as being a workable vehicle. But all the concerns are valid. We still need to move forward.
Okay.
With that, if you're ready for a motion on the full consent calendar, I'm ready to make one. If you want to have a separate vote on 4Y, we could certainly do that.
No, I want to go to public comment. So is Greg Dameron on the line?
No, Chair Haschak.
He's not, no. Not on the line.
No, he's not.
Okay. Okay, so we can take it all together.
Thank you, Mr. Chair. I will move approval of the consent calendar.
Second.
Okay.
Chair Haschak.
Supervisor Jordy.
Yeah, I just wanted to note my version of the website appears to be out of date, but I've been assured by the clerk of the board that under 4A for appointments and reappointments that Jim Hurst is listed as appointed to be chair of the Harbor Commission. It's just not showing up on my website, but I'm assuming it's showing up on other people's websites.
Mr. Chair, we need to have confirmation of that, and if
Yes.
not, to add it.
Yes, this is Deputy Clerk Lindsay Doherty. Mr. Jim Hurst has an appointment as chair of the Noyo Harbor District, has been added as number 9 to the special district appointments.
Okay. Okay, are we good with that then?
Mr. Chair?
Yes, Supervisor McCowan.
Well, and I think I've refreshed my iPad, but I'm showing a listing of number 1 through 9, number 9 being Miss Yvonne Bell for Potter Valley CSD.
Clerk of the board. So, clerk of the board.
I'm doing the ad right now. Just give me a moment. This is a large agenda, so it'll take a moment to upload.
Okay, so we have that understanding that that will be added.
Yes,
Can
sir.
we go ahead and vote?
And it, in fact, Mr. Chair, it has been added as number 9, and Miss Yvonne Bell is now number 10. So I'm glad we clarified the motion before taking action.
Okay,
Thank you,
So-
Supervisor McCowan. I apologize for the confusion.
no problem. Okay, so Deputy Clerk or Clerk, could you conduct a roll call vote, please?
Yes. Supervisor Brown?
Yes?
Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
And Chair Hashchak.
Yes.
The motion carries unanimously.
All right, we're moving on to item 5A, discussion and possible action, including an update associated with various disasters in Mendocino County, including the novel coronavirus COVID-19, and provide possible direction regarding essential services in Mendocino County, operational preparation and response, and associated countywide economic impacts. Okay, the sponsor is the Executive Office. And we do have a hard-timed item at 10 o'clock today, so we only have 24 minutes for this. So I'm going to turn it to
Mr. Chair, point of order.
Supervisor McCowan.
Thank you. So while we may not take a timed item before the time stated, there is nothing to prevent taking it up somewhat after the time stated. The timing is approximate, and usually the agenda includes a disclaimer that it'll be taken up when we're able to get to it. So again, the timing means we can't come to it before that time. I don't think it's appropriate, given recent events, to limit us to 24 minutes on discussion of COVID. Thank you.
Okay, thank you. All right, so I'm going to turn it over to CEO Angelo, the Executive Office.
Thank you, Chair Hashchak. I would like to follow up on a question that came up regarding the last COVID update, and this was regarding the state and the tiers. And a question that came up from this board, and actually a very good question, is not that what's in the tiers, but why that those particular guidelines are in those tiers. What is the why? And so I said that during the 2 meetings that I have weekly with Dr. Galley, I would ask, and I did that. I suggested that the state really look at putting out more information to the counties and therefore to the public, so the public had a greater understanding of what the epidemiology was with these tiers and why those regulations exist in purple and red, et cetera. Dr. Galley was surprised with the question, and his answer was that he would consider it. And so I did follow up with CSAC. I have not had an opportunity to follow up with Dr. Galley again, but I did follow up with CSAC. And CSAC, the CSAC team that works with Dr. Galley and state CDPH and works with the counties on these calls with Dr. Galley agreed that he definitely heard the question and definitely was considering it. So I want to assure this board that the question was asked. I do not have an answer right now. I do think that the state is busy right now with the surge that we're in and the fact that we now have 41 counties in purple. So I do want this board to know that at the next opportunity that I have, whether it's with the Rural Caucus or whether it's with the Kitchen Cabinet, I will ask the question again. And so right now I have no affirmative answer from the state regarding putting out the why as to what's in the tiers. I would also like to say that we are preparing under the good work of Dr. Corin and Dr. Duhan. We are looking at a vaccination team. We certainly hope that the information we are getting from the state and certainly from the federal government regarding vaccinations, not just the vaccine, but the actual vaccination operational process, that this will be smooth. The county's role will be in marketing this and education and information with the public. And so we have been working, Becky Emery, Kelsey Rivera, the public health officers, Darcy Antle, myself, on putting together a vaccination team. And we have good nurses in public health right now who are in communicable disease and do our vaccines and do our flu shots. And so we will be developing a team. There is more work in public health right now than there are staff to do the work. And so we will be looking at a separate team for this because this will be a large endeavor and certainly one of the key components to bringing down the spread of COVID. Additionally, and Dr. Corin will be talking about our latest efforts here around the tiers and where we are, but we are also looking at additional staff as part of a surge team. You know, if we listen to what the state is saying, we will be in this for a couple months, and our staff absolutely have been working 24/7, and there is a degree of COVID fatigue, probably from the Board of Supervisors on down. We do have the approval for a COVID unit, and we have money still from the state for a COVID unit. We are looking at those positions and utilizing those positions to hire more bilingual staff as well. So more to come on that. And lastly, I would like to say that I want this board to understand what's happening within this organization. You know, as the numbers surge, and again, I will leave that to Dr. Corin, we have been closely following what's happening within our organization. There is not a department that hasn't been hit one way or the other with some response to COVID. One is there are staff throughout the organization that do have COVID fatigue. I believe it is real. And also there are COVID causes as to why employees are not able to come to work. So we keep track weekly, actually HR keeps track daily of what's happening in the departments. Right now we have 48 staff, may not seem like a lot when you have 1,200 employees, but that is 48 staff who are out of their offices right now or not working just because of COVID. That doesn't include anybody else who is not here either on leave or whatever. And we know that what is reported to HR, and it is a directive that the departments must report to Human Resources if they have employees that have close contacts or have tested positive or in the process of testing. And so that information is collected by HR as long as the department heads report it. And we have a weekly call with the department heads, and they're actually very good about reporting and very good about working with HR and the executive office around keeping their staff safe. So again, 48 employees right now that are COVID involved in some way. Some of those ways, of course, is we have employees that are positive for COVID and are home. We have employees that are close contacts and are in quarantine, not isolation, but in quarantine. We also have employees that are home because of childcare or because of a lack of childcare and intermittent childcare that is COVID related. And we also have employees that are in quarantine due to travel. So I just want this board to be aware of what we are experiencing throughout the organization. Certainly, Chair Haschak mentioned the fact that we are short-staffed here in the clerk of the board office. That is true. And I think we can find that throughout the departments, and this county is experiencing a reaction to COVID as well. And we're hoping over the next 2 months that as we continue with our masking and our social distancing and attempting not to involve ourselves in gatherings, that we will all remain safe and keep our coworkers safe. I will continue to report to this board on what our status is within the organization regarding COVID. And with that, Chair Haschak, I would like to turn it over to Dr. Corrin, if that's okay with you. Thank you.
Very good. Dr. Corrin, good morning.
Here we go. Good morning, all. And thank you, Mr. Haschak, the rest of the board, and CEO Carmel Angelo. It's a little bit longer report because, as you know, a lot more is going on. But I'm going to start with the usual data presentation. And this is as of this morning. There were 6 new cases. 2 of them are Latinx. A total number of cases at this point is 1,311, 809 of which are Latinx. There are 73 in isolation, 164 are quarantined, and there are 9 presently in the hospital, 6 in the county, 3 are in rehab out of the county. The average case rate has jumped to 12%. I don't know if you remember this, but 2 weeks ago we were down under 7. And the positive test rate has climbed up to 3.85. We have lost 1 member of our community, so the total deaths now are 22. There was a child care outbreak in Fort Bragg, which is now resolved and contained. There was an outbreak in juvenile hall caused by a COVID positive child who was transferred from the state of Nevada. It involved 1 youth, multiple juvenile hall personnel, 1 court reporter, and was mitigated, and the last of the outbreak testing is this week. Redwood Cove is going through some containment and mitigation now, as they've had 1 resident and there's another staff person who is positive. These are very serious congregate living situations in both the nursing home and juvenile hall, and because of the good work of our contact tracing team and our responses with testing, we've gotten them under control. We did have 1 business that really defied the quarantine orders, calling a worker back before quarantine was complete, but it was due, we feel, to a misreading of the orders, and we are clarifying that with the frequently asked questions now. We have numerous other non-outbreak related, potentially serious cases that were contained and quarantined. We've been following employment carefully and not illuminating any specific industry. The majority continues to be community spread and close contacts. An analysis of our data showed just recently that in the last 30 days, over 50% are due to spread in the home. I'm going to give a little update on testing. The new Optum application, after losing the UCSF contract, has gone through to give us an additional Optum lane in Fairgrounds and a travel team which could be moved around the county to outlying areas, and we are working on scheduling. Binax Now and other antigen tests are being used in our partner clinics. That's the rapid antigen test that has just been recently released in the last month, or it's actually been a little bit more than a month. As far as vaccines, this is a very important thing. 2 have been approved, a Pfizer and a Moderna mRNA, a new technology that's making it through, these 2 are making it through phase 3 trials with excellent results in the range of 90 to 5% activity. Pfizer is the very difficult one to store. It has to be kept at 70 degrees below 0 Celsius, and it has to be shipped all that time. They ship only a minimum of 985 vaccines in a box, it can only last in this frozen situation if there are very restricted openings to this box. So it's really going to be available, we think, to large groups of people. The Moderna is another vaccine that ships 100 to a box and will last 30 degrees in a regular vaccine refrigerator or freezer. Both require a booster shot. None have been tested yet with children. We're told that there will probably be 4 million doses available in December and January, which is clearly not enough to do the entire country. CDPH work groups have been formed within California to re-look at the science behind the safety and efficacy. And a lot of this is because there are questions about how it's being vetted by the current leadership in the FDA. There is another group with the CDPH that will look at the logistics, another to look at law and ethics and equity, especially trying to distribute this to underserved populations and rural communities like ours. And a huge amount of work will be going into messaging to address issues like safety and efficacy, fears, and the anti-vax movement in the country, which would really seriously limit the use, the uptake of this vaccine, and change our prospects for some immunity as a population. We are coordinating as a local health department with the CDPH because there will be a phased approach to distributing this. First, distributing it to our healthcare workers, SNF workers, and first responders. We have encouraged our hospitals and skilled nursing facilities and long-term care facilities to register for distribution by CVS and Walgreens, which are contracted on to actually administer those vaccines to our SNFs, skilled nursing facilities. We are beginning to convene a hospital and departmental regular meetings to prepare for this new modality, because while the hospitals will take care of their personnel and nursing homes theirs, we're going to have to develop a plan to distribute this throughout the county. There are other new treatments that are available now. Remdesivir, you remember, has been around for a couple of months, and it goes to moderately severe inpatients. Now there's a new monoclonal antibody infusion that is for outpatients who are mild to moderately ill and has been very successful in trials. The county has only received 9 doses so far. So the protocol for distributing these is being worked on, and our hospital health department meetings will go over some of that. You're aware now, of course, of this huge surge in the last 2 weeks. In the United States, we've seen a surge, and I'll just try and put it into some perspective. It took us 10 months to achieve 10 million cases, and only 10 days in the last 2 weeks for the next million cases. In California, our hospitalizations have increased 38%, and the ICU has increased 34% from 2 weeks ago. Remember that hospitals and or the overflow from hospitals and ICU is something that we're desperately afraid of, because that will limit care for people not only with COVID, but people who have heart attacks, cancer, strokes, pneumonia, and so on and so forth. So we really want to protect our hospitals' capacity, and these numbers are very important for us to track. In Mendocino, our case rate went up from 6.57 from November 11th to 12 is being reported today for the last 2 weeks. And our test positivity has increased, oh, I left that out here somewhere, to 3, or to, it's still in range, excuse me for a minute, 3.85. It had been significantly lower than that. This is happening also before what we expect to be huge surges after Thanksgiving and Christmas and New Year's. Remember, we saw a surge after Veterans Day, and compared to these holidays coming up, that's small, but the effect was quite large. Some thought is going into why that was. Cold weather contributes. We know from the flu experience, it's because more people are indoors. But also cold weather has been found with recently released data that the viruses actually survive longer indoors or in cold weather and with the current humidity. So along with that, we expect more spread because of travel. Cars are very small places. Public transport, air travel expose many more people in small enclosed spaces. Gatherings, hugging, kissing. At any other time, we think that was great, but right now it's a threat to life and liberty. So the governor has decided to put an emergency brake on all of California. The tiers are now based on 7-day averages rather than 14-day averages, and they are evaluating them once or twice a week, sometimes more than that. And he's also said that there is not a wind down period. So when they announce on Monday, it will be expected by Tuesday for people to close whatever needs to be closed and increase the restrictions. Most counties are moving back. 41 counties have moved back, with very few counties staying at the same, and very few counties are outside of the purple range. We must be no less restrictive than the state. So we are following those orders. We're now in the purple tier. And I'll just remind you, bars and breweries are closed. Restaurants, gyms, places of worship, wineries, and personal care are all only allowed outdoors. Retail indoor capacity has gone down to 25%. And let me say, one of the concerns that's been raised statewide is that monitoring capacity has been not going well, and I don't know how it is here in our county, but we are looking at that. Schools, if they were opened while we were in the red tier, may stay open, but if they were not able to open, then they are not allowed to continue their opening. They should continue to do distance learning. The governor is also considering a statewide curfew. And they are looking at the epidemiology of that feverishly. A lot of this takes a lot of scientific investigation of huge numbers. Enforcement is very problematic all over the state. What we as a county have begun to do is compliance assessments, which we do with the same staff that goes around and looks at how restaurants and food handling and so forth are carrying out their responsibilities. And the department's approach to this is that it's educational. We want to make sure that we're giving the store owners and others who have people in their facilities that they are protecting them as much as possible. Messaging is going to be very, very key. So we all need to be very consistent. We fear there's tremendous amount of fatigue in following those instructions. We want to teach compassionately. It is a difficult time. If we do it correctly, we can get out of this accelerated surge in 6 to 8 weeks. It is predicted. But we really do need to all hunker down and help each other. So I'm releasing, I think it'll go today, a new guidance or advisory on travel and holidays. And we have updated the guidance for gatherings. It was up to 12 households, but no more than 20 people. We have decreased that to no more than 12 people. We're updating the frequently asked questions on quarantine because of the error that was made by one employer. And really the holiday and travel guidance is extensive harm reduction approach. The basics are we want everyone to mask all of the time unless they're alone or with a household member only. So in the past, we've said mask at these times and these times, and now what they're saying statewide is pretty much mask all the time unless you really know you can't pass on something that may not be symptomatic. You may be pre-symptomatic, or you may have a case of COVID that is asymptomatic. The new data about masks is interesting to report, shows that the masks also protect the people wearing it, whereas we thought it was only protecting the community around you. It does both, according to recent research. 6 foot distancing, we still want to encourage. Washing and sanitizing hands is very important. And ventilations, including rooms and cars, is very, very important at this point. So with that, I'll close my presentation. And if there's any questions, I'll be happy to answer them.
All right, thank you, Dr. Corin. Very good work on this. And certainly it's hard times for everyone. So let's, we'll go to 10 minutes of questions for you. And then we have this, we'll go to our CAL FIRE presentation. So if anyone's ready to present on COVID, you know, just we'll come back to you after the half-hour presentation from CAL FIRE. Okay, so are there any questions from the board for Dr. Corin?
Mr. Chair?
Yes, Supervisor Brown.
Thank you. It's been brought to my attention that our tracers will be off during the holidays. When will that period of time take place? Or is that a fact or not a fact?
I'm going to defer to ask Becky Emery to respond to that, please.
Good morning, Supervisor Haschak, members of the board. Becky Emery, I'm the Department Operations Center Manager. Supervisor Brown, if I may, through the chair, as to your question, the staff in the case investigation and contact tracing will be off for the day of Thanksgiving. They will be off as of for the day of Christmas and for the day of New Year's. We are working right up to the day before and the day after on each of these events. We are also identifying any high-risk individuals that are in their homes so that we can still identify individuals to make contact with those people that have tested positive and that are high risk based on their current factors so that we can do checks with those people. The labs will not be pushing through on those days, so we won't have additional case notifications at this time that we're aware of. And so it's for those reasons that we are closing specifically for those holiday days.
Thank you very much. So it's the 3 days, not a 2-week or...
We will continue to work throughout the holidays. It is the 3 specific holiday days. We are hoping that if we can get all of our work done on the day before Christmas Eve and Thanksgiving, that we'll be able to close out shop early, but we certainly have the full intention of getting the work that we need to make sure is done, ensuring that people are in isolation and quarantine on those days, and that we've made all of the notifications that we need to, especially on those high-risk individuals, to ensure our monitoring is continuing.
Thank you for that clarification. Thank you, Mr. Chair.
Supervisor Jordy.
Yeah, Dr. Corrigan, Fulbright Business asked me that they've heard about the 25% reduction or 25% occupancy of their retail business. This is actually a waiting room for an auto repair place. But they've also heard of the state cracking down and what's to come. And so in the example of, say, a waiting room for an auto repair place, this is a time of year when people are getting their cars serviced because of the winter. And is there anything that they need to be prepared for in terms of additional shutdowns? Or are they safe at saying they can have a 25% occupancy of their waiting room?
Yeah, at this point, 25% is what it's restricted to. And the reason for that is clearly we want to maintain spacing. And the more people that are in an area, the more there's breathing out of germs by someone who obviously doesn't know that they have it for one reason or another, maybe before they become symptomatic or asymptomatic. And we really want to keep the amount of suspended viral particles in the air to a minimum. So not only should there be a restricted number of people there, they should all be wearing masks, they should all be distanced, and the ventilation should be improved if it's not already done so. So that's an important addition as well. In the last few weeks, we've seen the CDPH and others recommend increased ventilation.
Okay. Any other questions from the board?
Chair
Haschak.
Yes, Supervisor McCowan.
I will defer. I think I heard one of my colleagues jumping in. I actually probably have 10 minutes worth of questions. I'd like to come back to Dr. Corrin after the CAL FIRE presentation, if we could.
Okay. Dr. Corrin, are you available after this presentation?
Sure. Yeah.
Thank you. Okay, Supervisor Williams.
Yeah, Dr. Corrin, can you talk about what the change in tier means for schools which have not yet opened? And then part two, there's been some confusion over whether school openings are more restrictive in our county than other counties in the same tier. Can you talk about whether there are differences, and if there are, why?
We are going by state guidance as far as the tiers and the schools. So the schools were able to open for the short window while we were in the red tier. Anyone who took any of the schools that took advantage of that are able to continue their being open and opening more if they need to. They're considered open. I did have some discussions with the principals and board members. And as a result of that, I issued some school guidance, which is just advisory interpretations of the state school orders. We are not in any way more restrictive than the state. So that should not be an issue. I've really been very interested in seeing the schools open, but they need to be done safely.
And based on what we know now with the statewide and national surge, do you have any guidance for schools so that they can plan? When might there be another opportunity to safely open?
You know, I honestly, Mr. Williams, I cannot say. We are looking at probably another 6 to 8 weeks of surge. And that's, I would say, if we hunker down and we can really keep it under control. But this is the winter, and it's the first winter that we've had COVID among us. And the last many months that we've dealt with COVID, there has not been a national response, and we've been surprised every few months. And so I don't want to venture a guess. I don't want people's hopes to be up. What I think is safe at this point is the distance learning, and I would go forward with that. And we'll see what transpires. If we can really hold this down and get back into the red tier, then there would be an opportunity to open, and I would support that.
Thank you for the clarity.
Okay, Dr. Corrin, there's been talk about this, the Oregon model, where they're naming the businesses where the outbreaks are happening versus the California where we aren't. So what's your opinion on that?
You know, I'm not sure that we have clear business spread or reasons to shame people. In our county, we've had a couple of outbreaks. The businesses that have been affected by that have been, once they found out, have been incredibly cooperative to protect their customers and their employees. And so I think if there were resistant businesses, we might consider a campaign like that, which is another form of messaging. But at this point, it's not what I would favor. Becky, did you have something to add to that?
I would just add that to date, we have shared all state defined outbreaks with our community. So we have been sharing those outbreaks as they have occurred, as they meet the state criteria for those outbreaks to be considered as an outbreak. And that criteria has changed throughout this event. But we have issued press releases and we have shared that information with our community.
Okay, very good. It's certainly nice to hear that the businesses are cooperating and being good partners in this.
Definitely. I would add, Chairman Haschak, that not only are they being good partners, but they're engaged right now in figuring out ways they can help us. It started with the Mask Up Mendocino campaign. They've been passing out masks and hand sanitizers. And they're also looking at ways that they can offer testing to their own employees at the site of work. And that's a big job for them to pull that together. And I'm very proud and happy to say that they're working on that.
Excellent news. Okay, if does anyone else besides Supervisor McCowan have questions right now? Okay, if not, we will we'll skip to item 5B. And thank you, Dr. Corin and Becky Emery. And we will be back in about half an hour with more. Okay, so item 5B is discussion and possible action regarding a presentation from CAL FIRE, Mendocino Unit Chief George Gonzalez on CAL FIRE's fire fuel reduction plans and projects intended for completion in Mendocino County prior to the 2021 fire season. And this was in response to an agenda item that I brought forward a month ago or so to have CAL FIRE do this presentation. So we're very honored and pleased to have Chief Gonzalez with us today. Certainly, we're thankful for this rain and the end of the fire season, hopefully, in Mendocino County. But we certainly appreciate all the work that Chief Gonzalez and all of CAL FIRE has done for the historic fires that we've had in Mendocino County with the August fire and the Oak fire. So welcome, Chief Gonzalez.
Good morning, everybody. How's it going?
Oh, good. Good to see you.
Nice to see you. So currently, our models are indicating that we have a below average rainfall season coming up. So what that's telling us is we're gonna have another aggressive fire season for 2021. With that being said, we have approximately 15 projects throughout the unit in strategic places for fire breaks, fuel shading, and tactical advantage of any wildland fire was to occur. I've been pushing really hard to get the National Guard crews, the Army National Guard, and we are, as of November 2nd, we took receipt of Army National Guard crews. My plan is to have the first fire center in the state utilizing fuels crews and the National Guard crews. And currently, due to the dwindling numbers of inmates, Chamberlain Creek Camp was selected because of the proximity to Parlin Fort Camp to be downstaffed and for CDC to take their inmates to other camps. There was only a few inmates remaining. They are in the process of evacuating the camp on the CDC side, but we will be going in, remodeling it, and making it a fire center. The fire center will have the Army National Guard crews, it will have our fuels crews, it'll have all of CAL FIRE resources as far as we'll still have the dozer, we'll still have 24/7 response and equipment there. This is a great thing for Mendocino. We noticed that with the firefighter hand crews and the fuels crews that we get much more work accomplished. And the crews are here local, so when we need them, we have them much quicker. As far as the projects, we have the east and west side of Ukiah. We will maintain those as we can. Those are critical to the fire breaks in a populous area. We plan on burning a little bit on the west side, hopefully a few hundred acres around the perimeter. We will be burning on the east side as well. We've started to burn around the bridges, which is out in Boonville, and we'll continue to burn out there. All critical infrastructure within the county, we're sending our crews on days like today, and we're prepping all those areas. We're giving them a good ring around the area, and we're making it safe. That way the infrastructure could defend itself during a wildland fire. So we have the ability to start doing that, and that's what we've been doing. It's actually, that is the actual #1 priority for the winter. because it's attainable and it's a relatively short time per infrastructure. Repeater tops, radio communications, the gas line and AT&T fiber optic cables that come up the 101 corridor up by Laughlin, things like that. So we are in the middle of prepping and continuing to maintain those. We burned about 110 acres last week out in Boonville at the Bridges project. We have Shamrock Ranch, which is another priority project for us. And that should be a few thousand acres worth of treatment and burning. The Hopland Research Extension Center will be another couple hundred acres of treatment and burning. That one's very dependent on the weather. It's all of a grass type of model. We have about a 20 or 30,000 acre project above Covelo on Redwood Empire land. And that's a great spot above like Blue Nose out in Covelo to make a significant fire break. And I believe we might be able to tie that fire break into the current 97-mile wide fire break that we started from Pillsbury all the way through Covelo. That's a few blades wide. That one also I'm working with the Forest Service to maintain for future safety of the unit. And that one, negotiations are ongoing, but at least we'll have the ability to open it up in case of an emergency fairly quick because the work was done this last summer. We still have Corson, which is on the east side of Ukiah, off of Ore Springs Road, a couple hundred acres there. There is a fairly large shaded fuel break, and that one ties into like Robinson Creek, and it goes down into the 253 area. We have Lenardi out in Covelo, about 1,700 acres adjacent to the Eel River. Ongoing will be the Sherwood project, working with the Fire Safe Council and with the fire department, lending them crews and equipment to maintain what we currently have. We were able to utilize the FERCO project from last year. We were able to utilize that this summer on the Oak Fire for access and egress, and it proved to be a phenomenal project. It was a governor's project, and we went forward with it, implemented it, and we actually got to use it, which was amazing. The evacuation process for brook trails, the contraflow, everything was spectacular. It was probably one of the best evacuations I've seen in my last 28 years. Highly impressive, and I hope to continue that not only in the Brook Trails community, but throughout the county. Cow Mountain, we're gonna have an ongoing BLM VMP with the Cow Mountain area and all BLM areas in the county. The Cow Mountain area is a strategic one to keep our fires from going into Lake County and having Lake County fires come into Mendocino. But it is difficult to work with another agency and to adhere to their policies and procedures for CEQA or NEPA or any of those. The Nash Mill project in the Boonville area is near completion. I'm sorry, is there a question?
No, I don't think so. Go ahead.
And then the last one is Mitchell Creek in the Fort Bragg area that's going to be under maintenance. And we're going to continue maintaining that one as far as a fire break and a shaded fuel break. Those are the end of the 15 projects. I am available for any questions.
Well, I guess I'd just like to kick this off by saying thank you very much for all the work you did. Certainly the Oak Fire was a tremendous scare in the Willits area, and the August Fire for our whole county, but especially Covelo area. I guess my question is, what is it you need from the Board of Supervisors or the county that would help you continue this work for vegetation management to prepare us for the next fire season?
Great question. Stuff that's attainable. I'll start there with information outreach, information education to the county residences. A major bottleneck that our department has, and it's specific to CAL FIRE, is we hired an environmental scientist to expedite the process. We have foresters on staff. The only thing that's a major bottleneck for CAL FIRE Mendocino unit is the archaeological review. And we have to forward our stuff to CAL FIRE Santa Rosa. The archaeologist comes out, and the larger the project, the more walking and grading the archaeologist does. I get it. His name's on the actual licensing and application, so I understand the concern. However, Mendocino County is one of the last counties that could actually burn and burn large plots of land. So in order to get the archaeological review completed, it's taking quite a bit of time for that last final process. So I don't know if the county has access to archaeologists or on contract. My thought was if I could venture outside of the CAL FIRE system, hire somebody from outside of CAL FIRE as far as archaeology review, assign them to projects, and then they could be briefed to the CAL FIRE archaeologist, and then we can continue from there. So it would take projects from about an 18-month time frame to hopefully about a 6-7 month time frame. And that's probably our biggest bottleneck.
Right, thank you.
Mr. Chair?
Yes, Supervisor Brown.
Thank you. And thank you, Chief Gonzalez, for being here with us and all that you've done through this wildfire season, not only locally, but what CAL FIRE has done throughout the state. It's been quite a year. I wanted to ask, I have heard, and I could not find anywhere on my computer the information, but that agreements have been signed with the state to work more closely with the feds. It may have been a MCERA's agreement. Are you aware of any agreement that's been signed like that between the state and the federal government so they can get some of these jobs done?
The only one I'm aware of is the Rattlesnake Project, and that's where I stole the Army National Crews from Nevada Yuba Placer unit, and we have them here in Mendocino as of November 2nd. Now, as far as us going on federal lands, I have not heard anything specific, but that would definitely help us out with our BLM projects.
And we have a lot of BLM, and I will try to think of a way and share that with our CEO and with you to what group we can go to and maybe get these agreements working better, because I believe BLM is key to protecting many areas from wildfires throughout our county.
Supervisor Brown, you're 100% accurate. If we could treat the entire corridor from south of Ukiah all the way and tied into the Highway 20, that is largely BLM land, and it's all really a non-native species of brush that's out there. So that would be a major fire break for us. I would support that heavily. That would be wonderful if we could get going with that. It is on our queue, but the actual federal process is taking us some time to navigate.
Well, I think it's going to be wonderful that we'll have more of a connection to the White House soon, and with a Californian being the vice president, so we may be able to gain some support that way as well.
I am hopeful, absolutely.
Very good. Supervisor Jurdy.
Yeah, Chief Gonzalez, great to see you again. You're always really a bearer of great news, usually. I just wanted to pass on a thank you from the Mitchell Creek Simpson Lane neighborhood for the work that CAL FIRE did on the coast and their ongoing effort to maintain. It may be called a fuel break, but I think it's also seen as a possible egress into that neighborhood should there be a major fire. So again, just a big thank you from the neighborhood for the work that CAL FIRE did there.
Thank you, Supervisor Jurdy. Yeah, you're 100% correct. It is the route and the egress and access areas, and those have been on the Furco Road on the Oak Fire proved to be priceless. It allowed our equipment to get in there unscathed from traffic, and it allowed roughly 5,000 people to be evacuated from Brook Trails, contraflow, utilizing both lanes down the hill. So thank you, Supervisor Jurdy. Thank you. I appreciate that.
All right. Any further questions from the board?
What?
Chair Haschak.
Supervisor Williams.
I'll defer.
Mr. Gonzalez, Chief Gonzalez, what more can we do as a county to support your vision?
I think as far as county, I think the information and education is going to be key. If we have some sort of access to archaeologists, that would speed things up. But information, education on the county side. We need to continue to go forward and make Brook Trails an example of what we could do countywide. If you start to look like out on the coast, the Mitchell Creek areas where we could start assisting every community with primary access egress roads, that's where it starts. Access is the number one. And then number two, you know, we can start putting fire breaks in, things like that. So notification, education to the local civilians. Every little community has a priority road where they get in and out. Vichy Springs area, Pine Mountain area, out on the coast, Albion area, there's key roads everywhere. And we're more than willing to help out as long as we can get the locals to understand what we're doing. We're not there to environmentally impact anything. We're just treating, if you will, what I'll call the Caltrans road system, you know, within 30 feet of each side of the road, and that helps everybody out. So to answer your question, I'm kind of long-winded, Supervisor Williams, but I think it's right now would be the information education to absolutely inundate the county with. Mendocino County has gone from a coastal unit, and now we are essentially a Lake County fuel model. So we're having the most fires we've ever had in history. And they're also the largest fires in California. They're no longer mega fires. We had the first giga fire of the state of California. So it's time that we all go forward and start actually helping each other to treat properties, road systems, things like that.
Thanks for the answers and for keeping us safe.
Supervisor McCowan.
Thank you, Mr. Chair. Thank you, Chief Gonzalez, for joining us for your presentation. A lot of great information regarding the 15 projects that you noted. Would you be able to make that available to the county? Possibly it could be posted to our website for this item so the information is readily accessible. It really is a great update on all of the work that you're doing. So is that in a form, or could you easily put it into a form that you could share it with the county and with the public?
Great idea. We can absolutely do that. In fact is, at the bottom of the projects, I'll put in a little paragraph on how everybody could do their part by notifying, starting to widen road systems, things like that. That's a great idea. Thank you.
Thank you, Chief. One thing I wanted to zero in on the Western Hills project, because the county certainly worked closely with CAL FIRE, City of Ukiah, other agencies on that. And I believe you stated the intention as with many of these projects, is to maintain the work that was already done. So that would be presumably keeping up the dozer fuel breaks, the ridgetop dozer clearings, but also you indicated there would be some more prescribed fire in the Western Hills. And actually, I believe with the work that CAL FIRE was able to do over the last year, I think we're set up to potentially do a considerable amount of prescribed fire in the Western Hills. Is that accurate?
Yes, sir. Fact is, Supervisor McCowan, with the current weather that we're getting, the long-term forecast shows about a 7 or 8 day break. And after the current weather cycle passes, it takes right around 7 to 10 days to burn again. So this might be the perfect window to go up there late next week and get pretty significant burns in around the perimeter and throughout that entire project. You're absolutely correct.
Thank you. And then has the environmental work been done that would support that prescribed fire, or is with the fire itself, is it less of a concern, or do we run into the same issue with the archaeological surveys?
I believe all that pre-work was already done. Now it's just a maintenance level, and we have it under one of our VMP projects, so we can go back and maintain. And I might have that here. It sounds like we will be able to maintain that. It went from a 3-year CEQA process to a 10-year process. So it sounds like we might have the ability to increase this to a 10-year project and maintain this as we go for the next 10 years.
Right. And then does that mean that in the case of the ridgetop dozer lines, where whatever has been there has been evaluated, it's been disturbed, if we were to come back, like starting, even if we maintained it annually, 10 years from now, would we have to do another environmental review to keep that same fuel break maintained?
We would, but if we keep it within the same blueprint, it's a much more expedited process because it's already been researched. It's already been vetted. So it would be mostly of updating the contracts and going forward that way.
Thank you. And then one more on the Western Hills. I believe we have willing landowners up there. I've not heard of any that are unwilling, but they may not have reached out to CAL FIRE. If county staff were to make that contact with the landowners and kind of act as a bridge between willing landowners and CAL FIRE, can some of those properties be included in the upcoming prescribed burns?
Were they within the initial blueprint of the contract of the VMP up there?
Well, I believe they were within the perimeters of the work that's been done, but rather than go further into this, I'm sure you'd be willing to have a discussion with the appropriate county staff on what the parameters are of what is possible.
Absolutely. And if it is within the old blueprint, that would be better for us as well. We could do all of the west side instead of parcel by parcel.
Great. And then on the suggestion for the county potentially hiring an archaeologist, I think you indicated that could take a year or even more off of the process for moving some of these projects forward. One of those, I think, where this might be in play would be Cow Mountain. Is that accurate?
For that one, it would assist, but that one is on the federal side, and they have their own CEQA process, their own ARC review. So I'm not 100% certain how that works. Either way, if I could show up with documents in hand saying that we've done CEQA to this level, archaeological review to this level, it would speed it up regardless. I just don't know how that falls within the federal system. But I will tell you, for our current project that we have on Brushy Mountain, we've had our archaeologists out there probably 6 times, and that is the final phase of this project. But we've had them out there about 6 times, but it's such a large project, you know, multi-thousands of acres that we're having to walk and confirm and making sure it's appropriate for fires. So that's where we're kind of.
Thank you. And just thank you. And just one more, and I think we touched on this on September 11th. Didn't go into detail. Yeah, you're very diplomatic, but in addition to the different standards that the federal side has in getting projects moving forward, I think it's well known within the public safety community that there's also a different philosophy in fighting fires by the federal government. And I won't ask you to comment on that, but before we leave this item, Mr. Chair, I have a comment that I'd like to add. Thank you.
Okay. Chief Gonzalez, that if there's, let's see, I will contact your office this week to talk about the archaeologist and see what we can do about that. And because I certainly think that if we can expedite these projects, that would be a boon to our county.
Absolutely.
So I'll be in touch. You know, you raised the point about the Furco Road and the usefulness of that. And that was really with the help of Todd Patton, who's retired now from the Howard Forest Unit, but creating these MOUs with the property owners, because that's private property. And with the help of Brook Trails, Chris Neary, and Sherwood Firewise, we got those MOUs in place so we could do that work quickly. So if there's any of that kind of work that you see that we need to do, just please call on us as supervisors so we can outreach to people too. And then Supervisor Jurdy and I, as the ad hoc on one way in, one way out communities, we've been working on this, the CSA 3, County Service Area 3, which could create zones of benefit. And that way we could maintain some of those areas like Furco Road, or these areas that have been cleaned, but then after 5 years, if they're not upkept, then they will revert back to, you know, dangerous situations.
Yeah.
So we're working on that, and hopefully we'll bring something to the board in probably early February to move forward on this, because we know that if we can do that, that would probably help CAL FIRE out in maintaining these areas that are already created, you know, for shaded fuel breaks. So.
Absolutely, absolutely.
Okay, very good. We'll go back to Supervisor McCowan.
Thank you, Mr. Chair. And I want to thank Chief Gonzalez again for your presentation today, of course, but for the work that CAL FIRE consistently does to keep our communities safe. And I won't put you on the spot, but it's apparent to me, and I believe it's well known within public safety circles, CAL FIRE has a philosophy of, we will put the fire out. We will protect life and property, but we will also focus on putting the fire out. And we do not see the same philosophy at the federal level. They do not have a mission of putting fires out. They do everything they can to protect structures from burning down, to protect life, of course, but they don't see it as their mission to put fires out. So in 2018 and with the most recent conflagration in 2020 here, we have seen fires burn through federal lands, gaining momentum, and then they hit the state responsibility areas as full-blown conflagrations. And CAL FIRE did a phenomenal job in stopping the August fire once it got to state responsibility areas. And it was pretty scary for a while. And, you know, we got a couple of breaks with the weather at key points, but really it was the work of CAL FIRE and our other public safety partners that saved the day. But it didn't need to be at that critical juncture, is my belief. So, Mr. Chair, on September 11th, I believe the board gave direction to have this issue as an agenda item for the board to have the opportunity to discuss this difference in philosophy between CAL FIRE and the federal agencies, which doesn't seem to have the same focus on actually extinguishing fires to prevent them from flaring up as time goes on. And we saw that happen at one of the fires in Oregon, just smoldering along, no effort to put it out. The wind blew it up and it took out structures. Not sure if it cost lives. So I don't see that agenda item on forecasting through the end of the year. I do think we should try and engage with the federal authorities and invite Congressman Huffman's office to participate and the board potentially to consider a letter on this issue to see if we can make a dent in that federal policy. Otherwise, we remain perpetually at risk. So that's the question. When can we expect to see that agenda item, if anyone can speak to that? Thank you.
Okay. And with the election and the new administration coming in, maybe we'll see a change in that policy. I'll have to talk to the clerk of the board to see about the forecasting for that item. So Chief Gonzalez, we'd like to thank you very much from the board, from Mendocino County, for all of your efforts and your team at CAL FIRE. So thank you very much for being on the call this morning and updating us on what your plans are.
Thank you so much for allowing me to speak. Hopefully we get to do this again in the near future, just to keep the communications going. And to Supervisor McGowan, he was correct. We got involved in the August complex about 3 or 4 weeks after it had started, when it was approaching the state responsibility area. And we were able to put in over 350 miles of dozer line from south of Potter Valley all the way through Humboldt Del Norte. So we are very proud, and thank you for the support. It really does mean a lot. Thank you so much.
Okay, thank you very much. All right, we're going back to item 5A. We'll continue on with some questions. So if Dr. Corin's on the line. Is Dr. Corin available?
So Chair Hashtack, this is Deputy Clerk Lindsay Doherty. We just need a moment for the transition. Thank you.
Okay, there he is.
I am back.
Okay, Dr. Corin. So Supervisor McCowan has a few questions.
Thank you, Mr. Chair. I only heard a portion of the governor's press conference where he announced so many counties moving backwards. And the portion that I heard, he made an announcement regarding funding that was going to be made available, but the funding would be tied to performance of the counties. And I didn't quite catch what that was in regard to. Could anyone on the call enlighten me on that? Was it related to possibly doing more enforcement and monitoring, or what?
I can't answer that question. I don't think any final decisions have been made, but I think my sense is that he was alerting the counties that we need to, that we may get reimbursed for doing more work, but I don't know.
Thank you, Dr. Corin. Of course, the governor did move many counties back, and it's kind of the one-size-fits-all approach that we've been dealing with almost from inception. We have had limited indoor activity for gyms and restaurants recently. Have we been able to detect any increase in cases related to gyms and restaurants having indoor activity?
Our data, as far as I know, our data does not point to that directly. However, I will say that making decisions based on a very small data set would not be what we would trust for our researchers developing medicines or vaccines. We just don't have the numbers to be able to show that. When I've participated in state calls,
I didn't write anything about available.
I'm sorry. When I've listened on state calls, they are saying that these are the highest risk activities. Is eating in restaurants, people take off their masks, and exercise because they're exerting themselves and are breathing very heavily. So there's much more of an exposure to the viral particles. So this is based on very good evidence, but not from within our county.
Well, thank you, Dr. Corrin, and I would agree it's based on very good logic. And of course, we do know indoor activity where air circulation is not as it is outside, heightened activity, as you say, not wearing masks for the diners. All these things are increased risk factors. And I think I've seen reports in some counties, they've identified specific instances where a restaurant or possibly a gym led to increased cases. But in general, I think it's mainly based on the fact of the indoor activity and the type of activity without definitive evidence that these are actually driving caseload. My perception, and I would ask you, is this accurate as far as you know, both locally and statewide, I think consistently over the last 2 to 3 months, the data that we have would indicate the case rate is being driven primarily by personal gatherings of individuals in informal settings rather than business activity. Is that an accurate statement from your knowledge?
I think that what we've shown in our county is it's actually inside the home that the most numbers of cases are passed, and that was something that we've done in the last 30 days. Other than that, we have not seen outbreaks that would be a clear indicator that some of these activities or businesses being open definitely caused the spread. But the spread may happen in those businesses and then be carried home. That's what community transmission is. So we look for all those things, but we're not seeing clear evidence of outbreaks. And that's, and that I will say is also true to a great extent statewide, what I've heard.
Thank you, Dr. Corrin. Also, the governor, I think, appropriately emphasized the stress that increased cases put on hospitalizations, on ICU utilization, on ventilator utilization. Completely valid concern. In Mendocino County, in the last week, we've seen an increase in the number of hospitalizations, depending on the day, double or triple what it had consistently been for the previous month. We continue to see 0 cases in ICU, with few exceptions. So it would seem that our current hospital system is more than adequate. In fact, previous comments from our healthcare professionals, we are prepared to have 100 to 200 beds dedicated to COVID, if the need arose, obviously we come nowhere near that. We have never been in a situation where we would be talking about overflow from our hospitals and our ICUs. Am I accurately characterizing our local conditions here?
Well, for one thing, I think it's important to understand that the care of a COVID patient is very intensive for longer periods of time. So in the last week, I think we've only had 1 or 2 people in a intensive care unit in Mendocino County. However, when I looked at the state snapshot view, what the hospitals themselves report, there were beginning to be some staffing shortages reported at our Ukiah hospital. And so even though it may not hit and show the ICU has no beds, if the nursing staff is not adequate, then they can't staff those beds. The other thing that's happened is, we had an excellent labor force that was a voluntary labor force in California when the outbreak began. And a lot of those people are now in other states because the outbreak has switched to the Midwest. And we don't have as much backup now locally meaning California, as we did several months ago. So we don't want to, the rate of rise of cases in the last couple of weeks is severe enough that what happens is that the hospitalization rates follow that. And if we have a similar increase in hospitalization rates that follows a case rate, then we could be in a bind. And so we need to keep protecting those beds.
Thank you, Doctor. With regard to case investigation and contact tracing, and I do want to acknowledge all of our healthcare heroes, both in our county public health and in our private sector. Everyone involved in this effort, I think, has been doing a phenomenal job. And there was a time a couple of months ago where I think we were struggling to keep up with the caseload at that time. It certainly appears that due to the hard work of all involved, we've been able to catch up to that. But now with the current surge, more cases coming in, a doubling of what virtually a doubling of what we had seen over the last month or two. How are we doing in staying up with the case investigation and the contact tracing?
Well, I'm going to defer to Becky Emery in terms of the staffing. My sense is that they're doing very, very well. They have been the whole while. We did have a bump in the road in the last 2 weeks when all of our surveillance testing at OptumServe went over to the new laboratory in Southern California. And what happened there was that there were some problems with the laboratory's function at startup, and they had a large number of reports that couldn't be let out. There were inconclusive reports. And so then in the last week, we got quite a data dump. And, there have been a lot of patients who unfortunately have had to wait longer than our expectations are. The California program, the new OptumServe that depends on a California dedicated lab, is supposed to be getting those results back within 24 to 48 hours. And that was not happening. And it's one of the things that we're collaborating with the state and talking to the state, and they're looking into it right now. Becky, do you have anything more to say in terms of the personnel and keeping up with the contact investigation, contact tracing?
Certainly. Thank you so much for the question. We continue to manage the efforts. Our staff have done a phenomenal job in increasing their training so that they can share the information quickly and make sure that we have trained staff responding to this effort. However, we still have challenges, especially on the weekends, in making sure that we have enough staff to meet the needs for the number of cases that are coming in. Our daily numbers are very volatile at this point and changing. And so making sure that we have adequate staff to have timely responses has certainly been one of those challenges that we are facing, especially around bilingual needs. One of the things that we have used in this is the language line, and our staff have been very proficient in working through those processes to ensure that we are reaching out in and doing the case investigation and contact tracing timely for those individuals. But it has added some very, very long days for individuals because of the increase in cases that we have and with the challenges of weekend staffing.
Thank you. In the past, we had gotten assistance from the state, and are we still getting help from the state on contact tracing? And if not, could we renew the request for additional assistance?
Through the chair, we continue to receive assistance through the state for their case investigation and contact tracing. We also receive significant support from very dedicated disaster healthcare volunteers within our own community, and they are working both on the weekends. The state staff do not work on the weekends, and so weekends are staffed by county employees and disaster healthcare volunteers specifically.
Okay, so
thank you.
Supervisor McCowan, do you have one more question? Because we need to move on.
Well, I had a couple, but I'll make it one.
Yeah.
And maybe it's a bit more of a comment. So Dr. Corrin, you had mentioned that Governor Newsom was considering imposing a curfew. And presumably this curfew would direct that presumably everybody who was not engaged in essential business or fulfilling other functions that were allowed by the original shelter-in-place order would be curfewing at home. And yet we have just heard that the surge appears to be driven not by people out and about and accessing businesses, which my observation is most people, high percentage, very conscientious about the masking, the social distancing in those environments. And the governor potentially is proposing to require people to stay home. In many cases, we know people are living in crowded environments, multiple unrelated people out of economic necessity could be living in one dwelling unit. So the curfew would seem to concentrate people into those conditions that would threaten to drive the spread. Just at the time as we're going into the winter season, more people tend to be indoors anyway. The holidays are coming up. It appears that a curfew could be a recipe for disaster. Do you have any thoughts on that, Dr. Corrin?
Yeah, well, thanks for bringing that up. For one thing, let me remind you that the governor has not released any, that I know of, any orders for a curfew. I know that the California Department of Public Health is just pruning through the data to try and find out what are other interventions that we can make that would be sensible. Secondly, although it is true that we have a lot of contagion that happens within households, the concern is that after hours, people are engaging more in activities that involve restaurants, bars, gatherings, drinking together, and they may be at somebody else's house partying as well. And so I think that the feeling behind curfews is that there's more control when people feel like they have to get home and they don't have extended parties, they're not out drinking, that sort of thing. Those are the high risk activities. Telling a person to be at home for a few more hours, it's not likely that that's going to increase transmission because I would imagine when they go home, they'll be pretty close to going to sleep. But I don't think that the activities are the same. However, I must admit, I'm going to defer to the research and the orders that come down from the state. So I don't have a good answer for you.
Okay, thank you, Dr. Corin. Was that Supervisor
Dr. Williams, I have one last question for Dr. Corin.
Go ahead.
I see that Ukiah area is leading the way, disproportionately representing far more cases than we see around the rest of the county. When I look at the coast, I see businesses closing, many to never reopen. I see children impacted. And it's because the state is treating us as one unit, and Ukiah is putting us into a more restrictive tier. What can Ukiah learn from the rest of the county? What do we do to change this course so that Ukiah follows the same trajectory as the other regions?
Well, that's a good question. I think it has more to do with population concentration that we have here than that we have in the smaller towns around, and certainly on the coast. We also see a lower raw numbers in, for example, Willits. But I think that what's happening is this is passed from person to person, and where we have more concentrated people, which we do, and we have higher numbers of people in Ukiah, we're going to see more of an increase in those areas. What can we learn? I honestly don't know, but it's a good question, and we will try and look at it.
Thank you.
Okay. Yeah, Supervisor McCown, do you have?
Thank you. I do have. We're
going to go to a break right now, so we need to.
Okay, I have a comment when we come back, if I may.
Yeah. Okay. So
thank you.
Right now, thank you, Dr. Corin. And we're going to take a break for 15 minutes, come back at 11:15. Okay, so we're on break. Back. So we're trying to finish off this item because we have a lot more work to do. So Supervisor McCowan, do you have a brief comment?
Thank you, Mr. Chair. This is a critical item for the county, obviously. I want to clarify the question to the state. It's not necessarily why the tiers, although I suppose it's another way of stating it, but it's what is the data and science that supports the tier structure. This is a question the board has been asking at least since September 1st. It's disconcerting. Dr. Galley would have been surprised by the question. I appreciate that the CEO is going to renew the question. I think we need to be honest with our business community and our citizens. I think we're hearing from Dr. Corin that at a minimum, it's expected we will be in this current situation for 6 to 8 weeks. I think with the increased caseload in advance of the holiday season, that's probably optimistic. It appears there's the potential we will be stuck in the most restrictive tier well into next year, unless something dramatically changes. And all of the indicators for, I would say, the last 3 months point only in one direction. And that is we will continue to suffer restrictions based not on what people are doing when they're out and about necessarily, but what they're doing in regard to informal gatherings, something that we have limited control over. And I would ask this board again, is there any will to send a letter to the state pointing out the robust nature of our healthcare system, that we prepared, as we were told to prepare for 3,600 cases, 1,800 in ICU, 450 deaths. We were told by the end of August we would have 53 people hospitalized. None of that's come to fruition. We are prepared for a surge that may hit. I note the concerns expressed by Dr. Corin about staffing, completely legitimate, but we are driving people into poverty based on the supposition of what might happen instead of the reality of what is happening. There appears to be no long-term plan by the state to address COVID. The tier system, yanking counties and businesses back and forth from one set of restrictions to another on a weekly or even daily basis, is not a plan for how you live with an ongoing pandemic that is not a short-term event. Again, is there any will by the board to send a letter to the state asking that decisions be deferred to the local health officer rather than the one-size-fits-all of the state? Thank you.
I would support Supervisor McCowan on that letter, should he author it.
And I was just on the Rural County Caucus meeting at the CSAC conference the other day, and they were talking about the representation that we've had and the ability that we county or rural counties have had in shaping and creating more flexibility in the state system. And certainly there were many kudos to CEO Angelo for her advocacy on behalf of all rural counties, but especially on behalf of Mendocino County. So I'm just saying that work is being done. I think there has been work done in creating more flexibility for the rural counties. And so I'd like to see that continue on. I wonder if CEO Angelo has anything to say to this.
Thank you, Chair Haschak. I really understand what Supervisor McCowan is asking, and under normal circumstances, not that I vote, but really I would absolutely support what Supervisor McCowan wants. I can tell you that, and Supervisor Brown is well aware of this as well, because she has been advocating as well. And Chair Haschak, I know that in your new role now, representing the county, that you're attempting to do so too. I have 7 pages of notes in front of me that I won't bore this board with, but they are from the 2 meetings that we had Sunday night. And, you know, the state does have a plan. And, you know, if we need to ask the state to roll it out more so, we can do that. But the fact is, they do have a plan. You know, if anybody is watching what's happening on a global scale and what's happening nationally and what's happening in the state of California, there's no way to carve out Mendocino County, you know, from these actions and from this direction that the state is taking. You know, Dr. Corrin talked about how our numbers jumped up like 67%. The state, they're very concerned. Writing a letter, you can write a letter. It's not going to do any more than what has already been going on with CSAC. The Rural Caucus has worked long and hard, and the success that the Rural Caucus has had is really with the health metric that the small counties would not have to respond like the larger counties. The fact is, we're in purple. We're in purple because our numbers demonstrate that we're in purple. You know, that we do understand. And so I guess I would just say that we are not alone. The Rural Caucus and then the Kitchen Cabinet, of which I sit on both, very different issues. There is not a supervisor on the Rural Caucus that doesn't focus on economics and how economics and public health are married up in this process. So you can write a letter. I honestly don't think that will get us anywhere. I believe that all the counties have tried, and you know, you can write a letter. It's not going to get anywhere. That's one thing. And 2, I would request that if a letter is written, that that be reviewed by the chair, in the sense that we really don't want to send a letter that would give Dr. Galley and the state and the governor the impression that we are not current in what is happening with the state. So, you know, I know there's a lot of work being done. Certainly, you know, in speaking with Dr. Galley, the state doesn't want to close the counties down again. I mean, the discussion around curfew, they made it very clear. The governor was not enacting a curfew, he was talking about it. You know, Dr. Galley, the governor, they know the state is big. They cannot enforce a lot of the regulations that they would like to enforce. So, you know, I think that it is a day at a time. And, you know, again, whatever this board directs is certainly what we as staff will do. But I would ask that you really look at what actions you want to take, because there may be actions you want to take next week or the week after that might be more meaningful than just writing a letter right now. If you just want to write a letter because you want to write a letter, then feel free. But if you really think you're going to get anywhere with that letter, then I would wait until you have something that you can really discuss with the state. Thank you.
Okay,
and
are
the
there any
state
other
will
comments from
continue
the
to
board?
have, Chair Haschak, the state has an adjudication process, and we talked about this at the last couple meetings, that if you're in purple and you don't believe that you as a county, that your data supports being in purple, the state does have an adjudication process. We have not gone through that adjudication process because there's nobody in public health right now or that is working in the pandemic that believes that our numbers do not reflect that we're in the purple tier. Thank you.
Okay, any further comments from the board?
Mr. Chair.
Let me see if there's anyone else.
Yeah, I guess I have a comment. I see that we do have an increase in cases. It is a serious problem. I would appreciate seeing the state's data that indicates the restrictions that are being imposed will remedy the problem at hand. My greatest worry is we have this increase that we haven't been able to control, and we're setting the wrong restrictions. And next week, it'll only be worse. And it may be that we don't at a local level have that data to make an informed decision. We're relying on the state. It'd be great if they could show us their work. And so in as much as McCowan's letter would be a request just to see and share the evidence of the backing these restrictions, I think it would be valuable.
Okay, Supervisor McCowan. Supervisor McCowan.
Oh, I'm sorry. I was on mute. I appreciate Supervisor Williams' comments. That might be a compromise to tailor the letter instead to an explicit request for the data that supports the tier system, as well as the plan that we are now told that the state has. So, you know, looking at the September 1st letter that I did submit for the board to consider, virtually every point in there remains valid. It would need to be updated slightly, a couple of the dates and so forth. But if it's acceptable to the board, I would draft a letter for the chair's approval that would request of the state the data and science that supports the tier system, as well as more information on the state's long-term plan.
Okay, any further comment on that? I'll just say, I don't think this is going to do any good, like CEO Angelo said. I think that we need to be working through the rural caucus and CSAC, you know, and, you know, those channels, because if we, I think just a letter on our part isn't going to do it as much as collective action on the rural counties part. And I think that we're doing our, you know, we have certainly Supervisor Brown has been active in that caucus. I'm on those caucus meetings now, and CEO Angelo is very integral into the whole CSAC.
Chair Haschak, do you see any of those efforts producing the documentation backing the current restrictions? Would you expect that to come back based on these efforts?
Well, I understand that they've had successes, especially like CEO Angelo was saying about, you know, differentiation between the urbans and the rural counties. And so I see that work being done. You know, is there a request for the data? I don't know. We can make that request though.
Well, I don't
think that would be the proper channel.
I don't feel in good faith that I could argue to change any specific restriction. I don't have the data to intelligently determine whether it's appropriate for our circumstance. So maybe efforts are being made to change some of the requirements for rural counties, but that's a somewhat different effort than getting access to the research the state has already generated.
Well, maybe we should ask Dr. Corrin if he feels like he needs the data.
Well, Supervisor Haschak and the rest of the board, let me just say, just remind you all, this is a pandemic that we have not experienced for 100 years. The data is being developed as we live this. We have the best scientific leaders in the nation, if not in the world, who are working on that. And they're meeting with us several times a week to present what their assessments are. I, you know, as a physician for many years and, you know, have read a lot of research. Research takes more than a year to complete to publish it in a peer-reviewed article. They're doing all that in breakneck speed. And for people to try and understand what the data shows or second guess these scientists who are looking at it, I wouldn't do it. Let me just put it that way. I have to defer to the experts. Now, if you want to get some kind of data that you can crystallize down and see why this and why that, write the letter. But I appreciate that they're keeping us as informed as they are with multiple meetings per week. This is a very, very difficult situation. And I will say that they feel the weight of that. So while the governor has talked about, possible curfew, he's fighting not to do it. And so are the other people. These would be, public health measures that are very difficult on the population, but they would be, last chosen. They would not want to do that. So that's my opinion. I think I'm happy with the amount of energy that they're putting into it and the communication they're giving us.
Okay, thank you. Supervisor Jordy.
Yeah, thank you. Yeah, actually, the thing that concerns me most is, we're hearing in the news, Dr. Corrin's repeated it, the fact that that we're all anticipating a significant number of Californians and people across the country getting together at holiday season. We've got the 3 holidays coming up. And I got to tell you, I mean, not to cast aspersions on the news media or just the media in general, but the news media has covered this pretty extensively. And yet, if you were to watch television or stream a movie with some commercials, what do you see? You see commercials being run right now with people getting together for holiday season without masks in, gatherings. And you're seeing people in stores without masks on commercials. And to me, that would be the simplest thing the government could do, to regulate the cable companies, the internet providers, so they can't keep running these commercials that make it seem normal for people to be walking around indoors with other people that they're not living with without masks. And I think honestly, if we were to focus on one thing, I'd like to see some federal action on that level, because we all know that there's going to be some level of increased spread during the holidays, and the modeling that people are seeing through advertisements in media is telling them that that's normal and okay.
If I may speak, I think that idea in terms of messaging is a very astute suggestion. I would agree with you. I'm not sure how much we can do except to pass it up. And I'm not sure how much the state can actually enforce that. But it is an important thing. I would agree with you in terms of messaging.
Okay, so I'd like to move this along. We have Supervisor McCowan wants to do this letter. So let's see if there is a will of the board to do it. Okay.
Chair Haschak.
Yeah, Supervisor Brown.
I would have agreed fully with Supervisor McCowan back in September, perhaps earlier, because I was feeling the same way. But I believe the explanation from our CEO, what you have learned going on these statewide calls, and then as well as what Dr. Corrin has said, I think it would make us look silly. I apologize, Supervisor McCowan and also Supervisor Williams, but I'm going to be voting no.
Okay. Supervisor Jordy, do you have an opinion on this?
I trust that Supervisor Haschak, CEO Angelo, and Supervisor Brown and others are asking these questions verbally and trying to build coalitions. I'm not convinced that a letter is really going to make the difference.
Okay. Okay, thank you. So it doesn't seem like we have a majority for this letter. So if we can, let's move on, because we've got a lot of work.
Well, Mr. Chair, just a very brief comment while we're pulling the board. What a letter does is it's black and white. It's a formal statement at a point in time. It's retrievable, reviewable by anybody. And all of these individual or collective conversations out of the public eye have really produced very little. The allowance for the small county, that only applies if you're on the cusp.
We understand.
Okay, I'm just making the point. We've achieved nothing through all of our diplomatic efforts.
So we're moving on. Thank you. Okay. Are there any other presentations on COVID that we need to do? Is Deputy CEO Darcy Antle? or CEO Angelo, do you know of any others that need to be
No,
done?
Chair Haschak, I think we are done with this item. And anything that Darcy would have to say, she could say during the fiscal update. I think we could move on if that is the will of the board. Thank you.
Okay, very good. If it's all right with the board, we'll move on. Okay, very good. Item number 5D, discussion and possible action including reappointments to 6th member seat, 5th member seat, and the 9th member seat of the Mendocino County Employees Retirement Association Board. Sponsor is the Executive Office.
Good morning. This is Deputy Clerk Lindsay Doherty, and this is a pretty straightforward item. All 3 applicants are interested in being considered for reappointment.
Okay, any discussion from the board? See that Supervisor Jurdy is on that.
If I could just briefly say, the retirement system and Supervisor McCowan served on this board himself, has been implementing a number of fiscal reforms for the last maybe 10 years. And in many ways, it's in much better shape than it was 15 years ago. We have, I think, a solid representation from the public in both Catherine Smith and Jerry Harris. And I hope the board chooses to reappoint them. I'm grateful that they're willing to serve another term, and as am I. Thanks.
Okay, is there any? Yes, Supervisor McCowan.
Thank you. So I concur with Supervisor Jurdy's comments. I do think we have excellent, very well qualified members on the retirement board for the board appointments. There's one more, and I think that position, another board appointment, might be up for appointment also. And Supervisor Jurdy, do you know if that individual is willing to continue on if that seat is up for appointment?
Thank you. The remaining position it is open for appointment, and he's willing to serve until we appoint a replacement.
I don't think we should appoint one then. Thank you.
Hey, any further? Supervisor Brown.
I was just going to say I'm ready to make the motion after public comment.
Okay, we don't have any public comment on this, so we'll go back to the board. Supervisor.
I move recommended motion for reappointments of the individuals as listed to the Mendocino County Employees Retirement Association Board.
Second.
Okay, seconded by Supervisor Williams. Okay, Deputy Clerk, could you do a roll call vote?
Absolutely. Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Supervisor McCowan?
Yes.
And Chair Haschak?
Yes.
Thank you. The motion carries unanimously.
Okay, we're going to move on and try to fill in with agenda item 5E, if that's possible, if planning and building is available. So item 5E is discussion and possible adoption of an urgency ordinance for temporary group care facilities for the purpose of allowing for winter homeless shelters during the COVID-19 pandemic in 2020-2021 winter. So the sponsor is Planning and Building Services. I don't know if they're available right now.
Hello, Chair Haschak, this is Brent Schultz, Planning and Building Services Director, board members, and CEO Angelo, County Council Curtis. I'd like to have Julie Acker-Grog, our Chief Planner, run you through this quickly and tell you the reasons why we need this urgency ordinance, and we'll be all available to answer questions. So Julie, if you can take us away on this one and the need for this urgency ordinance.
Yes. Okay, very good, thank you.
Thank you, Director Schultz. Julia Acker-Krog, Chief Planner. I just want to make sure, can everyone hear me okay?
Yes.
Yeah, perfect. Great. So good afternoon, Supervisors, CEO Angelo, and Council Curtis. Before you today is an urgency ordinance related to temporary group care facilities for the purpose of allowing for winter homeless shelters during the COVID-19 pandemic and the 2020 to 2021 winter season. The proposed urgency ordinance waives certain zoning requirements for temporary group care facilities to be used as winter homeless shelters so that these facilities can operate in unincorporated areas of the county coastal zone. And it also provides as many options for homeless individuals to shelter in during the COVID-19 pandemic and the upcoming winter months. This ordinance exempts these temporary group care facilities from off-street parking standards and discretionary review, but still requires compliance with certain location factors, such as being on a publicly maintained road, not within a residence or residential accessory structure, and certain health and safety related requirements. In addition, this ordinance would allow for operation of these temporary group care facilities until April 1st, 2021. That's the proposed expiration date unless the board wishes to revoke it sooner. So that really concludes my presentation. I want to thank you for considering this item today, and I'm available for any questions you may have.
Okay, any comments from the board? Supervisor Jurdy.
Yeah, first of all, I want to thank Julie Acker for preparing the ordinance in very, very short order. On the coast, every year there is a winter shelter, and in all past years, it's been located in Fort Bragg city limits. This year, relatively deep into fall, the county was notified of a possible location for an extended period of time, a minimum of 1 month, at a location in the coastal zone outside of the city of Fort Bragg. And but there was not enough time for county staff to process a coastal development permit, and hence the need for this urgency ordinance. I did contact the property owner and neighboring community, and they are willing to host this facility. I do want to note that it potentially could be at this location for all of the winter, depending on the maintenance of their property during the operation. They are offering a 1 month lease with the option of extending it throughout the winter if the property is maintained properly. If that isn't the case, the operation would need to relocate to another location, possibly within the city of Fort Bragg. So it's in everyone's interest for this to be successful, and I hope it is. Thank you.
Any further discussion from the board? Hearing none, we don't have any public comment on this, so we'll go back to the board.
I would move the recommended action.
Second.
Okay, and it's been moved by Supervisor Williams, seconded by Supervisor McCowan. Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Williams?
Yes.
Supervisor Brown?
Yes.
Chair Haschak?
Yes.
Supervisor McCowan?
Yes.
And Supervisor Jurdy?
Yes.
Thank you. The motion carries unanimously.
Okay, so we do have a budget item that's supposed to take an hour, so we won't be able to start on that now. I think and we do have a timed item in closed session, so I think the best thing to do right now is to go to a break. We will do our lunch break now. We will do closed session items 9A, 9B, 9C in closed session, and we will be back at 1:30. We'll have a 10-minute break, and we will come back at 11:55 in closed session. All right. So we'll see you back in 10 minutes. Otherwise, we're on lunch break till 1:30. Welcome back, everybody. We're in session again. So reporting out from closed session, let's see, on item 9A, Supervisor McCowan did not participate and direction was given to staff. On 9B, Supervisor Jurdy did not participate and Supervisor Williams made the motion, Supervisor Brown seconded, and authority was given to County Council to engage in defense. On item 9C, direction was given to staff. Okay.
Chair Haschak.
So moving on.
Chair Haschak.
Supervisor McCowan.
I believe the report out on item
Supervisor
9A was incomplete. Thank you. Can you hear me?
Yes.
Okay, thank you. I believe the report out on item 9A was incomplete. There was a vote taken in closed session. I believe the Brown Act would require that vote to be reported. And whether there's an update on the report out or not, I have a comment that I would like to make for the record.
Okay. County Council, do I need to report out on the vote?
No, I don't believe a procedural vote is something that's required to be reported out.
Okay, thank you. Supervisor McCowan.
Thank you, Mr. Chair. On August 4th, the Board of Supervisors considered closed session agenda item 9E, identified as conference with legal counsel, anticipated litigation, significant exposure to litigation. At the urging of County Council, I recused myself from participation in that item. In violation of the Brown Act, no announcement of my recusal was made by the board chair or County Council either before or after closed session. Today, the board considered item 9A, identified identically to item 9E from August 4th. It was again requested by County Council that I recuse myself, which I declined to do based on my belief that there is no factual or legal basis for the agenda item. Likewise, I am not aware of any legal basis for requiring an elected official to recuse themselves. The board then did vote to exclude me from closed session. To this date, I have not been informed of any substantive basis for these agenda items. Thank you.
Okay, moving on to item 5C, discussion and possible action regarding presentation of the first quarter budget report on the status of county departmental spending and revenues for fiscal year 2020, 2021, and executive office recommendations for the fiscal year 2020, 21. And the sponsor is the executive office. So I'm going to turn this over to the CEO, Angelo.
Thank you, Chair Haschak. And of course, I have with me today Deputy CEO Darcy Antill, and we do have our budget team with Darcy, and of course, our auditor Lloyd Weir, who always participates in the development of the budgets and the monitoring of the budget. So I'd like to go ahead and open this item. And in the interest of time, I will go through the first few slides rather quickly. And I don't see where our PowerPoint is. Could someone put our PowerPoint up, please? Here we go. Thank you. Okay. So this is the 2021 first quarter report. And we know that we have had major disasters since 2017. This board is well aware because they have worked these disasters and led this county through these disasters since 2017. We know that the pace of the activity within the county has not relented, and during this time, the priorities of the county And the staff, under the direction of this board, we've shifted our focus at this current time to COVID-19, to disaster management, to recovery, to mitigation and resilience. However, part of our budget process is to do quarterly reports. I will like to say that with the first quarter report that we're doing today, we at one point put first quarter on the consent calendar and quickly decided that that was not the direction of the board, so we do first quarter as a regular agenda item. However, it's very difficult to look at the full year based on the first quarter. We do know at first quarter that the auditor comes in with the fund balance for the prior year, and so that is information that certainly is pertinent for this board to make decisions. But to look at first quarter and what's happening in a department and determine that that is the wave of the future for that department for the year is somewhat preliminary and possibly inaccurate. We look at the most accurate and valid information for budget decisions as mid-year. And so mid-year will be in a few months with this board. So we know that over the course of the last few years, and certainly this year right now, is we've had fires, pandemics, financial disaster, and we have received money from the state and from the federal government, much more money than we have gotten in the past. This is the one disaster. It's not like fire. This pandemic has brought in millions of dollars into Mendocino County from the federal government and from the state, and we have used that money to support the response to the pandemic, and along with that to cover our costs rather than using general fund. Right now, though, spending does continue, and we are concerned about spending of county dollars going forward. The reason we are concerned about the budget going forward, even though this budget looks pretty good today when you review it, is because we are still in disaster mode. That has not changed. We are in this pandemic. And the response to this pandemic is expensive. The counties have been fortunate to receive money from the state and to receive money from the federal government like we've never received before. But the challenge is this disaster, this pandemic response is unending. We don't see an end to this. We know that we will go into 2021 still in response mode. But the biggest issue is that right now, and again, we've talked about the calls with the state, that with CSAC, we are on calls weekly with the state. Right now, there is no guarantee of ongoing funding, whether it's state or federal dollars. We know that CSAC and the state is pushing the federal government for additional money come January 1, but we have no guarantee. So with that said, we have to proceed with caution and still continue to look at our reserve and to protect our reserve and add to it if we can, because we don't know what will happen in the future. So going to the next page, this presentation is very similar to others with a budget discussion, the board goals and priorities, which of course this board knows. Close out. We know that we are still very much focused on our communication system and our microwave system, and of course our recommendations that we make to this board. I also want to say that board members have asked questions about the PG&E settlement, and what we know is that yes, did we get money? Yes, we did. That money is sitting in the county treasury, and we are still looking at the requirements of spending that money and where we can redirect it. However, given that we have been very much focused on the day-to-day operational activities along with disaster response, we have waited to come to this board with a presentation on the PG&E settlement. Our goal is to look at bringing this to the board either at mid-year, which would be January or February, or doing a presentation to the board in January. We're not looking at reviewing the PG&E settlement dollars and coming back with the requirements for that money and also any recommendations on that money until January at the earliest, because we are still gathering information so this board could make an informed decision. Moving on to the next slide, you will hear more about the health plan and the general fund impact with the health plan. I would like to remind the board that many years ago, we had great fluctuations in our costs to our health plan. One year, the auditor gave money back to the departments. The next year, we had to increase the cost to the employees in the county by 15%. We never knew what was happening with that health plan. It was very unpredictable. Over the last few years, we have worked with our contractors to help us manage this health plan, and we've done very well, to the point that we had money that we had to spend down in a reserve for the health plan based on the state auditor, which we did. And lo and behold, it's only taken about 3 or 4 major claims right now to bring us into an area with the health plan that we may not have enough in reserve, and we're looking at increasing the cost to the county and to the employee of the health plan. Again, our salaries, this board directed $5 million be set aside for salary increases, and that $5 million was put aside. But if you look at page 15 of this presentation and you look at the fund balance or the carry forward that the auditor has given us as far as a number of $6.1 million. 3.3 million is in the miscellaneous budget, and it's a balance left of the 5 million. So the 5 million that was directed by this board to be set aside for COLAs and market adjustments, we have not utilized that 5 million. The practice in this county is to sweep all the general fund, which the auditor, in doing his job and doing his duty, did. But that $6.1 million figure, I think, is somewhat misleading because 3.3 million of that under board direction did go for balances for market adjustments and COLAs, and that goes into 21-22 as well. So we need that money set aside for additional salary increases. So you can see we'll be talking about compaction, employee relations, disaster, and jail expansion. On to the next slide. These are your priorities, what you've directed us to do. So I will go ahead and skip through these. And so if we get to, let me go to page 8 of our PowerPoint. Darcy, if someone could move forward. Page 8 is the 2019-20 closeout, and we know our good news is the final carry forward amount is a little over $6 million. We know that this is due, 1, to the shutdown of the county, so we did not have the usual operational expenses that we would have due to the shutdown, and the departments held their revenue. And the departments actually have done really well in saving money and watching their budgets. And additionally, the $5 million that there was $3 million, approximately $3 million that was left that makes up that $6 million. The bad news, of course, is the jail expansion. This is not unusual. This is not anything that was created by Mendocino County. This is just the cost of doing business, and we know the cost of development right now has gone up for obvious reasons. So the cost of the jail expansion has increased. We are still looking at the full impact of fire damages and what those costs will be. You'll hear a little bit more about the health plan increase and the high cost claims, where we need to add a little over $2 million to the health plan. And then, of course, working on the compaction and alignment correction, which is approximately $500,000. So with that, I would like to go ahead and turn it over to Deputy CEO Darcy Antle. Thank you.
Good afternoon, Chair Haschak, members of the board. We are having technical difficulties. We are not that far away from you in the other conference room, but doesn't appear that our slideshow is working properly. Are you okay with us proceeding?
Yeah, go ahead.
So for your reference, we are currently now on slide 9. This is typically a departmental watch list that we bring forward at first quarter, basically to let this board know that the finance team, the fiscal team is working closely with the departments to follow and monitor their budget projections at this time. This is the early projections. Of course, as CEO Angelo mentioned, we're still in the first quarter. While we're looking at this, we do know the 1000 series, that's what the payroll system hits for the year. We would expect it to be trending at 25.9%. And at this point, we're at 23.7 for the general fund account. So we're feeling that some of this may correct itself moving forward. And just a note there with the elections, we do anticipate that money coming in from a grant. So we're not too worried about the 143,713 for budget unit 1410. Moving on to slide 10, to discuss really briefly an update on the 2020 fires. So we have 2. We are very fortunate at this time that both of these fires have been declared federal disasters. So at the time of putting this report together, you can see the August fire had not been declared. 3 months after the start of this fire were we included in the declaration for this. Our dwelling count, as we have been up there for phase 1 debris removal, we have identified 2 additional dwellings, so that number has gone to 12. Phase 1 in both is underway. It would have been complete today, but due to the rain and the geographic location of some of these properties, our environmental health team and the state have had some challenges getting up and down into those properties. So it may be another day or so before phase 1 is complete. Phase 1 is the household hazardous debris removal. Phase 2 will begin early to mid-December. We are currently going to hold a town hall with the fire survivors from the August and the Oak on Thursday, the 19th at 4 p.m. to go over the right of entry forms that will need to be completed for this project. Again, the cost share of the county for the debris removal as well as our emergency response will be 25%. And the total estimate is unknown at this time. One to note on here, the federal government does not support cannabis debris, so it is not an eligible expense. And it's very likely that that expense will be falling to the county and or the property owners for that cleanup. At this time, I would like to turn it over to Deputy CEO Janelle Rao to discuss the microwave and other potential options for the county.
Good afternoon, board members. Janelle Rao, Deputy CEO. These are just a quick overview of what you can more thoroughly see described in Attachment D. This is the county microwave cost of ownership model. The board had received an update and presentation from the County Information Services under the Executive Office and have been working with the IT ad hoc, which consists of supervisors, Girdy and Williams, and the model that you see before you being recommended as far as receiving and cost recovery would be Model 2 as described in the attachment. If you go to the next slide, it'll show you again the internal county departments, external agencies, and those that we are exempting. One thing to note is that any public safety agency or county department that's considered general fund, the Information Services working with the budget team annually will be looking for a cost allocation towards that annually. And if there are any questions, we can answer, but it's more thoroughly described in Attachment D. Thank you.
Darcy, are you with us?
Sorry,
There
thank
she
you
is.
about that. We are still, again, struggling with some technical difficulties, but for your reference, we are now on slide 13, urgent funding needs. So there is a continuation, as CEO Angelo mentioned, for employee salary and benefits that were approved by this board for 2021 and 22-23. Employee compaction and alignment corrections. When doing the COF study, as you were aware, not all those things were taken into consideration, and we estimate that amount to be about I think it's 500,000. And then the employee relations ad hoc recommendations for the FTO payments out. We have the healthcare plan general fund impact will be approximately 1.1 million. And CEO Angelo reviewed that prior with you. And again, disaster recovery, preparedness, and mitigation. At this point, we are working on 4 disasters. We are still working in the 2017 disaster. We are still working in the pandemic, as well as the Oak and the August fires. And those will continue for years to come. At this point, we'll go into the health plan increase a little bit further. And we do have support if you would like to ask additional questions at this point, but we are recommending a 1.1 million increase in impact to the general fund this fiscal year, and we would be asking the same for 21-22. And the employee contract contribution to increase by 3% January 1 of 2021. Moving on to the carry forward, as CEO Angelo mentioned, this auditor controller came in with 6.1 million, but that was by reducing the miscellaneous set aside at board direction for the fiscal years 21-22, the COF and the COLA. So at this point, if you put that money back, you're looking at about 4.3 available carry forward from 2020. Funding options for 2021. We would like you to consider the CEO's recommendation with the health plan fund impact and a 3% increase to the employee's wage, the salary compaction and alignment correction, employee retention and ad hoc recommendations for the disaster FTO payout, IT infrastructure, the Cannabis Equity Program local grant, fire mitigation and local grant match, fire debris removal, the county cost share. Again, this is for the August and the Oak fire. Those numbers are undetermined at this time. Just a note to point that debris needs to be moved to an approved landfill, which are not in our areas. And as you can imagine, from Covelo to an approved landfill is quite a distance. And consider continued support for disaster recovery, again, for the 2017 fire mitigation, COVID-19, and then the Oak and the August fires. And we are looking at some UNIS upgrades. This would be for time and attendance and payroll and budget initiatives that we are working on. The next page, slide 17, is the CEO recommendations. Under this recommendation, I would like to point out, approve the first quarter department net zero adjustment, including the creation of a new budget unit for the transition to permanent housing project on Orchard. Here we identify that budget unit as 4073. I would like to say it's 4073 or a similar budget code within the HHSA department units that would be appropriate if 4073 is not the exact number. We would like you to approve the first quarter fixed assets which is on your attachment B, and then approve the one-time carry forward from 2019-20 for the funding needs of 2020-2021, attachment C, and direct staff to return to the Board of Supervisors on December 8th with a formal resolution adopting and amending 2021 Mendocino County budget based on the approved direction. And we are doing that this separately this time because we just didn't know how things were gonna flow. At this time, I would like to pull up attachment C. That's in your packet as well. So you can see and we can discuss any changes that you may want to make for the board direction, which at this time, if you scroll to the bottom, Tim, we have approximately, and of course I can't see that from here, but over $400,000 that we have remaining after we fund the above projects. But we do know at this time, our general fund reserve account is sitting at 12.2 million. Just something for this board to be aware of. Last year, we took 1 million out of that general fund reserve for roofs. The auditor, per the direction of this board, put back 500,000 of it at year end. With that, I'll turn it back to Carmel Angelo for any additional comments.
Thank you, Darcy. I think that that's probably a pretty good explanation of where we are. We do have Peter McNamara from our health plan here to answer any questions. I will say that there was a time when, as I said, what happened with our health plan was somewhat erratic, where one year we would increase it, the next year we wouldn't, one year we would give money back, and then we stabilized where we went through a period of time for a few years where every year we increased the health plan contribution by 3%. What happened was we did not have any exorbitant claims. We were doing quite well, and we built this reserve. And that's when the state auditor and controller said that we had to spin down our reserve, which is what we did. And now we're at a point where we only have a couple million in reserves or a few million in reserves, and we're at a point where we're getting some high claims, and we know that we are at risk. So that's why we are looking at increasing the health plan contribution yet again. And as I said, when we went through a period of time where every year we increased by 3%, 3% was not a huge amount for the employee. Certainly it added up for the employer, but it was spread over year after year. And we were able to balance and do just fine. And so here again, this year we are saying we believe that we need a 3% increase, and most likely you will see over the next few years that we will be back to this board every year with a 3% increase. I think everything else speaks for itself. Again, you know, when you see just one line that says we have a carry forward of $6 million, it looks like a lot of money. And again, our COVID experience, departments did not spend money. We were able to give money back to the general fund, including the dollars that this board allocated for our increase in salaries and benefits. And we know that that increase will continue. It's like the health plan. As we put 3% forward every year to increase the cost of the health plan, we will have increased costs with our staff every year. So I would encourage this board to allocate or to reallocate the dollars back to saving for the increase in salary and benefits for our staff. And with that, Chair Haschak, I will turn it back over to you. Thank you very much.
All right, are there any questions?
I have a question.
Yeah, Supervisor Williams?
Yeah, there are three areas that I see we may be underfunding, and I'm wondering if now is the time to bring it up in relation to the budget. The first is planning department. It seems we have open positions. We can't attract planners. The market's telling us the cost adjustments were insufficient. Given that planning is mostly cost recovery, should we plan a fee hearing and adjust the budget such that we can fill the open positions.
And that's a question for the CEO.
CEO or planning director, I would think.
We'll see. Is Mr. Schultz with us? Okay, we're bringing him in. I will certainly let him speak first. Thank you.
While we're waiting, go on with your second.
Yes, sir.
Hello, Chair Hashik. Brent Schultz, Planning and Building Services Director.
Okay, go ahead.
We do have, we are recruiting for the open position, so I can tell the board that, and Human Resources has been diligently helping us try to fill the vacant positions. And so we are doing that. Most of our open positions that's true what Supervisor Williams says, they're in planning or the planning department in Julia's group, and we do desperately need those. So we're working hard to get those filled. As far as looking at, the fees, we always welcome the chance to go back and look at our fee schedule to see is it recovering all of our costs.
Director, you may have missed the question when we were pulling you in. Should we be thinking about adjusting our budget and salaries so that we can fill these positions, or do you feel confident that you can fill at the current rate?
I believe I think it would be beneficial to look at some of the upper end positions, the senior planner, chief planner positions, those upper level ones, to see are they, now maybe they were covered by that study that was done, but I think it would be well to look at that. I get anecdotal stories that some people can move to other surrounding cities and counties and work less and get more money. So, but I'd welcome a study of that first before you just launch off and propose anything. So, yes, I would welcome working with Human Resources on that.
Thank you. And question two, do we have any mental health needs in the jail that should be funded? Any adjustments in the budget to cover mental health in the jail?
I don't know who that question is addressed to. I don't know.
CEO, perhaps.
Okay, sure. Unless we have someone from, if we have Dr. Janine Miller on, I'm not sure we do. So let me go ahead and answer that. Right now, this county pays, the sheriff pays NAFCARE for mental health services. So I would say that if we wanted to add general fund to the jail budget, that we could get a proposal from Dr. Miller, and I know that she is working on something right now that could improve mental health services. But I would also say that if we bring in county staff or another contractor to provide more and better mental health services in the jail, that the sheriff's office reevaluate the NAFCARE contract so we're not paying NAFCARE for mental health services and paying another contractor for mental health services because those services are not being provided by NAFCARE. So to answer your question, we will evaluate that, and Dr. Miller and Health and Human Services could come back to this board with that evaluation and a proposal if this board directs it, only if this board directs it. Thank you.
Understood. Maybe I can ask my colleagues in a moment. The third and last, abandoned vehicle abatement. I know we've only been able to do so much because of limited budget. I believe the county's current contractor has been forced out of business, and we're going through an RFP process. There's now a backlog, and having these vehicles, some of which have been burnt over roadside, invites more because it's seen as tolerable. And so we really need to catch up on the backlog. Do we need additional budget to catch up? Yep. And perhaps this is for planning or code enforcement.
Chair Hashik, this is Brent Schultz. If I could address the board on this.
Yeah, go ahead.
Thank you, Chair Hashik. Brent Schultz, Planning Director. I know that John Burks and Trent Taylor have been working on getting a new contract for abandoned vehicles. So, and I don't have the precise dates on what, but I know they're working hard to get a new company in there to do that work. As far as, do we need more money in that budget? I would really would have to check on that. I haven't heard any requests for more funds is needed, but I could get back to the CEO's office on that.
So Chair Hatschak, are you able to poll our colleagues to see if there's support on these 3 items, not to adjust funding, but to have staff come back with any funding requests? What I'm trying to mitigate is 3 or 6 months from now, hearing that we didn't make good on a commitment because we didn't have an adequate funding. Now is a good time with the budget being presented to make changes.
Okay, so your idea is to poll on each one of those issues?
Sure, unless you want to do all 3 together. And it would just be asking staff to evaluate those 3 needs and come back with any recommendations. And if there aren't any, that's fine.
Okay. Why don't we do them all together unless there's a issue with that? Is it all right to go forward with staff investigating those 3 items?
I would support that.
Okay. Supervisor Brown?
I will support it.
Supervisor McCowan?
I support it, especially the second item to review mental health needs at the jail. I believe we're aware there's some gaps there that aren't being covered by the current MCERA contract. And I also support, I believe it was the CEO's comment, if we are to augment mental health services in the jail, it would be appropriate to then adjust the MCERA contract as well. Thank you.
Okay, certainly. Okay, so I think we're unanimous on that. Thank you, Supervisor Williams. Supervisor Jordy.
Thank you. I want us to maybe take a step back a little bit and look at some of these items that we have. We have several that are, in my mind, they're really fire, not just fire, but emergency response and emergency preparedness, and I would say economic recovery from those emergencies. And I think we've been very circumspect in not discussing the PG&E settlement funds, but I think now's the time for us to begin that discussion. And we may have discussed this a little bit in closed session, but not necessarily in public. And I think, it would be wise for us, and I think we probably would all agree, to prioritize those funds for things that are short-term projects. They might be a project that requires 1 or 5 years of funding, that are for emergency response, capital improvements, economic recovery due to these emergencies, and preparedness for future emergencies. And again, we have several of those items in this budget presentation. I think if we think this through, I think we would agree that we could logically prioritize some of the PG funds for those expenses and not take them out of general fund dollars or out of our reserve. And just hope that we could discuss that a little bit.
Okay, my understanding was that Deputy CEO Antle was saying that they didn't know the specifications yet for what we could use the PG&E money for. So, Deputy CEO Antle, is there a problem with what Supervisor Jordy is saying?
Supervisor Hatschak, Darcy Antle, Deputy CEO. As you mentioned, I have not had the time since the money has arrived to be able to review any restrictions or guidelines that may have been placed on the funding that came from PG&E. With working in the disasters and the CARES money, filing for FEMA, I'm kind of strapped on some timelines. If I could ask this board if we could address that maybe in January or February, it would give me a little more time to review any of those restrictions that may be placed on those funds.
Chair Hatschak.
Okay. And let me just follow up. So at that point, we could kind of backfill the general fund with maybe some of those monies?
Supervisor Hashak, Darcy Antle, Deputy CEO, and I would, if that's the will of this board, I would believe that's a direction we could take, again, after we review the PG&E settlement further.
Okay. Supervisor McCowan.
Thank you. Well, and I do want to congratulate and appreciate staff for the hard work that has gone into this budget update report and presentation in the midst of the ongoing pandemic, working on recovery from the fires, having to deal with the threat of the public safety power shutoff. So obviously staff is doing an incredible job in bringing this information forward. However, I don't think the definitive authority for possible restrictions on the PG&E funds should lay with our budget analyst. I've been in communication with Auditor Controller Lloyd Weir and County Counsel Christian Curtis. They've raised the prospect that there may be some portion of these funds that should be used to reimburse, I think it was stated, special district. So maybe the road fund or something like that. We may have received funding based on, road fund expenses. I think that's what they're getting at. I think it would be appropriate to hear from both Auditor Controller Weir and County Counsel Curtis about the nature and extent of these restrictions. My communications with both of them left me with the impression that the great majority of these funds are unrestricted general fund. I do think we have to be very judicious about how we would choose to allocate any of it. I think it's logical to reserve the great bulk of it for disaster-related expenses or preparation for disasters, since that's the basis on which we received this settlement, was related to the disaster caused by PG&E equipment. So again, if we could hear from the Auditor Controller and County Counsel about are any appreciable amount of these funds expected to be restricted, or isn't it true that 10 million or even 20 million is unrestricted general fund?
If I may, Mr. Chair.
Yeah, County Counsel.
Thank you. I think Supervisor McCowan is correct that the issue is really that if the funds are reimbursing from a loss or an expenditure that was suffered by a special fund, and I think the roads are a good example because my understanding is that road damage was sort of a significant portion of the damage suffered within the fires. That money might have to go back into an account that would be reimbursing the fund from which it had come. And so I have flagged that issue for the auditor and for Ms. Antle. I think that what will be required to be able to answer that question is to look specifically at, what were the basis of the estimation of damages that went in there. My understanding is that there should be a fair amount that's general fund, but I really haven't looked at the specifics. I'm not really in a position to be able to tell you, and Ms. Antle or Mr. Weir might be able to answer a little bit better, but I couldn't tell you, what the numbers are or how that shakes out. I think that's the review that still needs to happen.
Hey,
Mr. Chair, if I may.
Yeah, Supervisor McCowan.
Well, the amount of the settlement is, I believe, 22,600,000 and change. Is there any doubt that there would be, at a minimum, several millions of dollars that would be available for general fund purposes?
I think that question was directed at me. I'm not quite certain. having not looked at the numbers, I really would be hesitant to offer any specifics. My understanding, again, is that a significant portion may be general fund, but someone who's looked at those numbers more concretely would have to be opining. I'm really just guessing.
Thank you. Well, perhaps Auditor Controller Weir would have somewhat more specific information since he's much more familiar with our various funds.
Okay, is Auditor Weir on the line?
Yes, he is, Chair Haschak.
Okay, Auditor Weir.
Yes, hello, this is Auditor Controller Lloyd Weir. Can everybody hear me?
Yes.
Yes. So, you know, this is the first time I think in my county life that the Board of Supervisors has been given the task of dealing with such a large settlement amount in the county, especially with the unknowns about how that money can be spent. We do have some homework to do on this, and even though there may be portions of it that can be spent in the general fund, I really think a good priority plan needs to be developed and vetted in front of the board. And we need to go down through that exercise before we just kind of peel dollars off at this point. I agree with Deputy CEO Antle that we need to look at any possible requirements associated with the settlement. And I know County Council is also trying to trace that down. So I think we need to come back with the rules and restrictions that we may have or may not have, and then present the priority plan to the board at that point in time.
Very good, thank you.
Chair Haschak, Darcy Antle, Deputy CEO, if I may, it was implied that we would not work with the Auditor Controller. Auditor Weir and I work closely together, and I also certainly work closely with Christian and the County Council on many items and would not venture into this without them. These estimates that were submitted to the PG&E settlement, we worked with County Council, Tammy Moss-Chandler, Director Moss-Chandler, and myself worked on those estimates. We honestly have not had the time to review any requirements that were submitted back with those documents, as County Council Curtis said and Auditor Weir. I'm happy to pull Tammy Moss-Chandler in to help review that to make sure that we meet all the requirements. But again, I think it's going to take us a bit longer. Thank you.
Okay, thank you. So certainly seems like we have the budget before us and we need to deal with that. And the PG&E settlement we'll deal with after Deputy CEO, the Auditor, County Council have time to review that. I think the board have time to come up with a comprehensive plan for it. So dealing with the budget we have at hand. Any further comments?
Chair Haschak.
Supervisor McCowan.
Thank you. So one of the critical issues that we've been faced with, and including a recent grand jury report, relates to our emergency communication system, which we all know we have been limping along with some glaring deficiencies. We do have included in attachment C reference to the hardened building to relocate 9/11 equipment, projected cost of $2.1 million, $210,000 recommended to be allocated, $1.89 million deferred. I'd like to ask what other critical elements of our communications infrastructure, emergency communications infrastructure, are currently not funded, or is this it?
So who's that a question to?
Anyone who can respond to it.
Mr. Chair, Janelle Rao, Deputy CEO. I'm not certain that I am actually the person to respond, but I'll give it a shot. The board has adopted, and within this current budget, there's a $19+ million ITMP, and that includes emergency response and emergency infrastructure. I would like to also note that staff are currently working on application for CDBG funding, and the 911 bunker project is included in that, along with other critical infrastructure, including phase 2 of the microwave system, along with other needs with the microwave system. There is also a $158 million CIP that's included in this budget. And that, of course, includes many emergency response or emergency infrastructure needs as well. I hope that answered the question.
Thank you. I appreciate that answer. So potentially we are either funding or we're cautiously optimistic about the CDBG process that we will have the funding for our critical communications infrastructure. I believe that's what I'm hearing.
Okay, Supervisor Jordy.
So generally, I support the package that's put together by the CEO's office. I do have a couple questions on a couple items. And again, with the backup that I really would like for us to have an opportunity to look at funding some of these items, not out of general fund dollars, but out of PG&E funds, because I think many of them really relate to fire recovery or emergency recovery and emergency resiliency. But anyway, a couple items I have questions about. We have a line item of, I guess it's $350,000 for administrative building backup generators, local match. So this is to install permanent backup generators. I'm not clear what exactly is that proposal.
Janelle Rao, Deputy CEO. Yes, sorry. That is for permanent generators. We have a plan and a proposal that we've submitted. There will be partially that is funded through grant funds. Darcy Antle can explain more to what the funding source is. So this would be our match, correct?
So just on that point, I just think before we commit to those that specific project, we should consult with Sonoma Clean Power. I know that PG&E and the City of Ukiah supply power to the admin center, but I think Sonoma Clean Power probably has a better grasp on the likelihood of needing backup generators. We have seen a vast improvement in PG&E's delivery system in some respects in the last year. We don't really know what their improvements will be in the future, but I think there are people out there who have a pretty good handle on it. I think we should be sure before we commit such large funds to something like diesel generators to know that that's really the right course of action. And then also, I had a question on the healthcare proposal. The plan sponsor, the county, pays 75% of the healthcare plan. The employees pay 25%. So I was a little unclear as to why the presentation referenced employees paying an additional 3% and the plan sponsor paying an additional 20%. If you kept that 25-75 ratio, which I think is how the plan works, as far as I know, why if the employees paid 3% more, would the employer contribution be anything in excess of 12%?
Chair Hashtack, this is CEO Angelo. I'm not sure if that question could best be answered by Deputy CEO Antle, or if Peter McNamara is still on. in our meeting. So Darcy, is that you? Is that Human Resources, or is that Peter? I think Supervisor Journey brings up a good question.
Darcy Antle, Deputy CEO. Yes, we would like at this time to bring Mr. McNamara in to help support the conversation. A couple of years ago, the health plan took a holiday, and for the third quarter of the year, the plan did not get funded. So the employees got a break, and as well as the county. So the county was not putting additional funds in during that time to the fund balance that carries the health plan. That was really never the intention. The intention was that the employees would receive the break, but the county would continue to fund their portion.
They need that.
So at this time, we are asking to only have a 3% impact on the employees, and the general fund take a larger impact. And at this point, is Peter on?
He is.
Hey, Peter.
Afternoon. So Darcy has it exactly correct. When we were doing the analysis for looking at premium holiday as a result of, I believe it was the state controller indicating that you had to buy down reserves, it was intended that it would be the employees that got the premium holiday, and it ended up that both employees and employer got a premium holiday. As a result, a $12 million reserve was reduced to just under $6 million. You've had a couple of bad years, which is not unusual. It happens, every 3 to 5, in about a 3 to 5 year cycle, you have about 3 good years, 2 bad. You've seen that happen, and as a result of the premium holiday in 2 successive years of both employer and employee, it's left you in this position.
So I'm not questioning the need to rebuild the reserves. I'm questioning the legitimacy of saying that the plan should be altered in a way in that it is no longer a $1 from the employees and $3 from the employer. It just seems as we rebuild the reserves, it should be $1 from the employee and $3 from the employer.
Well, you're right, except that I think the point that Darcy was making is that it was never intended for the employer to take the premium holiday. So you should have been putting your 75% of what that premium was into the reserve account, which you were not doing. And so I think all they're asking is that you simply fund what you intended to fund but did not.
Well, I'm saying that doesn't make sense. That I think that what the county did makes sense, that both the employee and the employer were not contributing to the reserves when the reserves were substantially higher. And it seems to be if we want to ramp up to be a loan from the general fund to the health care fund to build up the reserves more quickly, if that's an urgent crisis. But it seems like it should not just be a gift from the general fund to the.
I'm sorry, I missed some of that.
Is there a reason why the general fund can't, if there's truly a need to rebuild the reserves urgently quickly, can the general fund simply loan the money to the healthcare reserve fund and have that fund restored through a 3-to-1 contribution with the employees and the employer?
Yeah, that's outside of my my purview. That probably would be your county council, a question for your county council.
So I want to support agreement with Jordy. The arithmetic here has confused me. I hear the theory behind it, which sounds right, but then when I see what we're actually doing, our actions don't match the theory.
Chair Haschak, this is CO Angelo. If I could jump into this, I think that Well, first of all, I appreciate Supervisor Jurdy's question. I think it's a good one, and I think that Peter's right. He has a role with us, but these are not decisions he would make. So I would ask that that staff, that we go back and we take a look at this. I think there are some areas that we do need to look at. One of them is our labor agreements when it comes to the health insurance increases. That's something that we need to look at. And we will confer with County Council to be sure that whatever action we recommend to this board is legal and also complies with our labor agreements. So this is an area I would ask the board for some patience with. We will absolutely look at this, and we could come back at the next board meeting with an answer to this board on this question. And so thank you, Supervisor Jurdy. I think you've cleared up something that has been confusing for us, but there may be some very simple reasons as to why this is presented from us staff to this board. But we will clarify that, review it, and come back at the next meeting.
Okay. Further comments from the board?
I'd also like to see Supervisor Jurdy on the communications, and I recognize we don't have the answers yet. Maybe it'll be January before we can get to it, but I think he has the right idea.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. So we've heard some discussion of the current vacancies and planning and building, possibly the need to augment salaries to aid with recruitment. We'll get a report back on that. We have a couple of other issues that we've discussed that, if we fulfill it, would require more personnel, more funding. I'm not asking we give direction to this today. It may well not occur until after Supervisor Brown and I are off the board, but I want to highlight these. I don't want us to lose sight of it. We heard from Sheriff Kendall recently regarding Sheriff's Office needs, and he is asking for 10 more deputies, I believe. He might be asking for 10 in hopes that he could get 6. Don't really know. But we know that cannabis, while we struggle to have a workable, functional regulatory system for legal cannabis, illegal cannabis is running rampant, particularly in the Covelo area and other areas of the North County. Currently, there's no effective counter to this. And I think additional funding for the sheriff, perhaps, and one question will be, if we grant the funding, can you make use of it? Can you fill these positions? Because the sheriff is down positions now. But something needs to be done to begin providing effective enforcement. We are really not attacking the smaller grows that create neighborhood impacts that are often more troublesome to the citizens than what's happening out in the hills. But we're also not effectively interdicting the totally egregious, off-the-hook, environmentally destructive grows. One way or another, it's the duty of the board to try and gain control of that situation. And I think it does go hand in glove with perfecting a more functional ordinance. The other leg of this we've discussed, because there's many perhaps clearly illegal cultivation situations that really wouldn't or shouldn't require the sheriff's office. It's simply people that are growing without permits. They're not authorized to be doing what they're doing, but it's not in the heavy organized crime mode, perhaps. And so we're all aware of the Humboldt model. We heard a presentation earlier. Supervisor Williams sponsored that item before the board. we've given direction to have a further discussion of use of aerial imagery to assist in gaining compliance with cannabis cultivation. My understanding that is in the pipeline to be an agenda item before the end of the year. However, the aerial imagery by itself is not a magic bullet. I think probably most of us are aware that that's one element of a successful program, but it's not a substitute for having personnel who can use that information effectively. Again, it's going to require additional personnel, additional funding if we're going to be able to implement that. Again, I'm just highlighting these as needs that I believe are out there. And, you know, at some point, again, the board has to make a commitment. Not only will we do everything we can to achieve a functional regulatory system for cultivators of good faith to be able to come forward and succeed, we have an equal duty to rein in the clearly illegal cultivation operations that will never be legal, have no pretense of ever being legal, and are creating neighborhood conflict in residential areas and egregious environmental destruction in outlying areas. Thank you.
Well, Supervisor McCowan, I agree with what you're saying. And Supervisor Williams and I sponsored that agenda item over a month ago. And since that time, I've been working with Sheriff Kendall, excuse me, to get that information together. And they're collecting the data. Supervisor Williams and I have notified Assemblymember Wood and the state that we are going to come with this letter of request for additional funds for help in dealing with the situation, you know, the sheriff's lack of funding to address the super grows, the cartel grows and all that. So Sheriff Kendall, I know is working on this, and we will get that letter off as soon as possible. Until that time, I think that we don't need to be dedicating money at this point. We should wait and see if the state will come through.
Thank you, Mr. Chair. I just want to make sure, and again, it won't be me, it'll be you and the new board, but I think we need to keep both elements of this conversation front and center. Thank you.
Okay. Any further comments about the budget? Okay, hearing none. Is there public comment? I don't see any public comment, so back to the board.
Well,
Supervisor.
Chair. Yeah, so again, I think I could support what's been brought forward by staff, with the exception, if I'm reading this correctly, the board is being asked to provide a 20% increase in the contribution to the healthcare plan, which is in excess of the 12% that would be represented by the as 3 times the size of the. Actually, we should be providing 9% if the employees are providing 3%, and we're being asked to provide 20%. So I would like to see those numbers adjusted downward, and if it is truly urgent for additional funds to be infused into the reserves for the healthcare plan, that staff bring back a proposal for a loan from the general fund to shore up those funds to be paid back to the general fund. I realize the county would be providing 3/4 of the payback of that loan, but remember the healthcare plan, roughly half of the cost of the county's contribution comes from non-general fund sources. And what we're being asked to do here seems to be it's putting too much of a burden on the general fund the way it's being structured, if I'm reading this information correctly.
Well, I think that we need to look at those numbers, and I'm all right with sending it back to staff to come back with a greater explanation. I think that when you're talking about 3% and 9%, whatever, you know, we're talking about the quantity of money. So 3% for the staff or employee contribution and 3% for the county contribution is very much a different, you know, amount of money. I think the 20%, my understanding was that the 20% was to kind of refill those coffers that were inappropriately lessened. So I guess I would hope that the county staff would come back and explain it more clearly to us, and we just do this in the interim. Supervisor Jurdy.
Yes, it's just that one of our, I would like the staff to amend our attachments, because one of our attachments shows a contribution to the healthcare plan for 6 months of increasing the contribution by more than $1.1 million. And so it's not clear to me that we could both ask them to bring this back and approve that action.
Okay, so Supervisor Jurdy, how would you like to proceed with this?
Well, I would offer a motion to approve the recommendations offered by staff, with the exception of the increased contribution to the healthcare plan, directing staff to bring back a more comprehensive proposal to shore up the healthcare plan.
Is that a second, Supervisor Williams?
Yes.
Okay, very good. Any further comment from the board? Okay, hearing none. Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Williams?
Yes.
Supervisor McCowan?
Yes.
Supervisor Brown?
Yes.
Supervisor Jurdy?
Yes.
And Chair Haschak?
Yes.
The motion carries unanimously.
Okay, we're moving on to, thank you staff for that great presentation. Like, I forget who said it, but in the midst of all this, to get that together is quite an accomplishment. So thank you very much.
Mr. Chair?
Yes, Supervisor Brown.
Thank you. On the PG&E funding, and I know staff is really, really burdened, but we need to look at those restrictions, if there are any, because we still have a lot of emergency services needs, from the microwave system to officers on the road. I mean, there's so much there. And if we know where we can spend that money, we may be able to solve some of our problems we have now.
Yes, very well received on that. Yes, Supervisor McCowan.
Thank you. I do agree with Supervisor Brown's statement. These funds were received July 7th, and it's not really credible to me to suppose, and we were told all along these were going to be unrestricted funds, discretionary. It's really not credible to think that we're so unsure of the ability to spend these funds. So again, it's going to be a new board will be making the decision regarding these funds, but the longer the board waits to gain information on what portion of these funds, and I suspect the lion's share, are available for discretionary use, the longer you wait to find that out, the more we have unmet needs that we continue not to fund. Thank you.
Okay, thank you. Moving on, item 5F, discussion and possible action, including interviews with applicants and possible appointment to the Mendocino Coast Healthcare District. The sponsor is the Executive Office.
Yes, this is Deputy Clerk Lindsay Doherty. We have 2 applicants for a long-term appointment to the Mendocino Coast Healthcare District, and we have both of them on the line. It's Mr. Robert Scott and Mr. Norman Duval. So however you would like to proceed, Chair Haschak, with the interviews.
All right.
Chair Haschak.
Yes, Supervisor Williams.
Yeah, general comment I'd like to relay before. I had outreach from a constituent concerned that a lot of our boards and committees don't always represent the demographics of our community at large. And this one in particular, I guess, caught them by surprise that I'm sure it was advertised on the county website and the appropriate noticing locations. But the feeling is these positions are not getting advertised as well in the community, and that unless somebody knows to go and search for it, they're unlikely to know that there's a vacancy and an opportunity to serve. I promised I would pass it along. I did talk to county council about the timeline and learned that this is our last regularly scheduled meeting before the deadline.
Okay, I was contacted too by people from the board, and the question I have is, why are we making the decision and not the board?
I believe it's because this is what's allowed under election code for a vacant position. Perhaps county council could verify.
This is Deputy Clerk Lindsay Doherty. Yes, it is clarified under election code that if applicants have missed the deadline for submitting their elections paperwork, they may submit a letter of interest to the Board of Supervisors. And in many cases, we have only one applicant for a special district seat. In this case, we had two, and it was felt that the best way to decide on a candidate was to consider both an open session.
Okay, thank you. Okay, so should we give each candidate 10 minutes to talk about their qualifications and interest? Is there a problem with that?
Sounds fair.
Hearing none? Okay.
Mr. Chair.
Okay, so
is 10 minutes, to me, 10 minutes is an awfully long time.
okay, would you say 5?
Well, I believe they can do that. That would work.
Okay, does that work for everyone? 5 minutes each?
Yes.
Okay, very good. Okay, so we have 2 candidates. We have Norman Duval and we have Robert Scott. So, gentlemen, would you like to flip a coin for who goes first, or does it matter to you?
This is Deputy Clerk Lindsay Doherty. I would like to let both Mr. Duval and Mr. Scott know that they have entered the room muted. So in order to speak, you will need to unmute yourselves. Thank you.
Okay, Mr. Scott, Mr. Duval. Are you on the line?
Yes.
Okay.
Now,
Mr. Duval, Mr.
share video. Oh, how's that?
Very good. Who would like to go first?
Scott, you want to do it?
I believe Mr. Scott is joining us via phone. This is Deputy Clerk Lindsay Doherty. And Mr. Scott, if you're joining via phone and you would like to unmute your phone, just press *6 to unmute.
Okay, Mr. Duval, would you like to go first?
Fine, thank you very much. As you will recall, you appointed me in September to fill the incompleted seat of Mr. Lund, who left on it with several months to go. The district did not appoint timely, thinking that they only had so much time to do it, that close to an election and the registration to get on the ballot, which I attempted to do, but there just wasn't enough time to get that done. I came to your board and asked to fill the balance of the term, which concludes at the end of December 2020. In the several months that I have been on the board, I've been involved. There's a lot more happening than just keeping the hospital alive and getting ready for the rebuild or the replacement of the hospital. The concept of healthcare is broad and reaching out into all of the communities within the district. And we're working with Doctors Gray and Krieger in what is called the Hubs and Roots program of reaching out to every community in the event that we have yet another disaster, such as an earthquake or fires within the district, and the need for people to move, to leave, or to find other accommodation. These are all on the agenda for the healthcare district. I've sent to you just before your lunch break a map of the district that shows how broad its primary function is. I look forward to serving on the district for the next term. And I've been asked by the chair to work in choosing a legal counsel. I'm also working on the website design, and it's really the choice of the board to either bring in a person who has been in the community for well over 50 years, ran for the hospital board back in the early 70s, and again reapplied in 2018 for that election. And I'm back before you again today, and happy to answer any questions that you might have. Thank you.
Okay, thank you. Let's see, why don't we hold questions for afterwards? And we'll hear from Robert Scott right now. Okay, Robert Scott, you have 5 minutes.
Good afternoon. I hope that our system now is working and that you can hear me.
Yes.
Yes, we can hear you.
Can you? Okay, very good, thank you. I read the notice that appeared in the Fort Bragg Advocate encouraging individuals to come forward to serve on the Mendocino Coast Healthcare District. For 10 years, I had served on the board of directors of the Mendocino Coast Hospital Foundation, raising millions of dollars for the operation capital purchase of equipment at the foundation, at the hospital, but also had an opportunity to work with 2 different managements at the hospital as chairman of the Citizens Advisory Committee. People in the community that were talking with management to improve services on the Mendocino coast. We're very fortunate in having a hospital in this part of the county. I think that there's a strong interest in the local aspects of our community. I think that the bulk of the patients that attend, not only from local residents, but also people that are visiting our community, to create a very positive image for residents as well as visitors. I think that the current crisis of the pandemic is creating a good deal of stress. If I was appointed to the board, I think I would be very keen in making sure that we have a smooth transition between the new operators of the hospital, Adventist, and the community here in Western Mendocino County. Also, I think it's critical, and when I was on the planning committee briefly for the hospital, was to be sure that we know what our demographics are, that we're aware of the community and its characteristics, what our healthcare needs are, and then to begin to plan how to address that and then implement it with the appropriate funding for those services. I think the demography of the Mendocino coast has changed significantly. I think that it's an influx now of older retired people from the urban areas that are coming here to the coast. And I think that change in demographics needs to be looked at. I would also encourage state associations to learn what is happening elsewhere in the state. We do have an association of rural healthcare districts. And I think that it would be good for us to find out what they're doing. I have about 30 years of experience working in the business area, bring that experience to the table. That would conclude my remarks, and I would be open to questions.
All right, so I think that if we have any questions for the candidates, we should ask them of both candidates. So are there any questions from the board?
Chair Haschak, I have a question for both candidates.
Yes.
With Adventist Health taking over operations of the hospital, is our healthcare future secure? And if not, what are the risks?
Okay, so Norman Duvall.
The answer is no. That's not me. What is that? That interruption? No, in the lease agreement, as I understand it thus far, is that there's a 3-year walkaway provision that allows Adventist to wrap it up and leave. And so part of the responsibility of this healthcare district is to do everything that we possibly can to keep them here and want them to be here. So there's a public relations aspect to this responsibility that has not yet been spoken to, but it's very real. There's an estimated 30% of potential clientele to the hospital going out of town. And we need a balanced demographics. We need to bring back OBGYN. If we're not raising any kids or having kids in our community, we're going to have a suffering economy. You cannot just deal with the care and treatment of older folk and tourists, thinking that you've got a healthy climate to grow your community. And this community really does want to grow.
Well, thank you. And let's try to keep these answers to 1 minute. Okay?
Okay, good.
Robert Scott. Could you answer that question?
Yes, I think that it's critical. One of the concerns that I've had during the last several months has been the focus of responsibility and accountability to our community. Often I've seen in months gone by of mergers with smaller hospitals with larger national firms, of having 6 months later deciding that that would be something that would be considered would be the closing of the smaller hospital. I remember in my business career having been involved in 2 corporate takeovers of losing a position in one of one of those transactions. So I'm extremely keen and aware and would want to be sure that we have adequate protection for not only our residents that are patients at the hospital, but also our employees at the hospital as well. Thank you.
Okay, Supervisor Jordy.
Thank you. So first of all, thank you both for applying, and my paths have crossed with yours, both of you, over the years, and you're both very involved in the community. Former Supervisor Duvall, you've been involved in numerous committees, and Robert Scott, you've been a member of the Meadow Lake Credit Union Board, and your wife on the Food Bank Board in Fort Bragg. Could each of you just sort of give us an example of things where you've worked with other people on different boards? Maybe a success.
Okay, maybe we should go to Robert Scott first. Switch up the order. Okay.
Oh, that goes back a long way. So if you don't mind, I think my first area of public service was in Contra Costa County. I was chairman of the board of commissioners for the Contra Costa Housing Authority. This is back in the 70s. I have been a planning commissioner. I was chairman of the Economic Development Subcommittee for the city of Fort Bragg for a number of years, trying to build the local economy here on the Mendocino coast. I'm currently vice chairman of the Westport Municipal Advisory Council to the Board of Supervisors. Was nominated by Supervisor Jury, approved by the board last few years. Earlier had been involved with the Mendocino Coast Chamber of Commerce, representing the county from Westport.
Mr. Scott. I think it cut out on us.
Chair Hashak, this is Deputy Clerk Lindsay Doherty. It appears that we've lost connection with Robert Scott. He lives rurally over on the South Coast, so he explained to me that he may have some broadband issues. If he would like to rejoin us by telephone.
Hey, Mr. Duvall, would you like to answer that?
Thank you. As you know, I was on the board for 16 years, and following that, I volunteered to be on the Building Code Appeals Board, which didn't last very long. I twice was on the Mental Health Board and twice its chair. And I've been with the CASA organization since it was established in the county in 1995. And I have served now as the chair of the CASA board for the last some years. I'm seeking that I be replaced on that board really as soon as possible, having had more time waiting for a board member to stand forward. Since leaving the Board of Supervisors in 1995, I have just stayed in the county and offered service and assist as much as I possibly can. I've been in partnership in the real estate business, and part of the responsibilities in this healthcare district is the aspects of real estate. We're building a new hospital or rebuilding one. It is a major deal. It will involve millions of dollars. In my meetings with Bob Edwards, the former manager of the hospital, he said we have to budget 80 to 100 million. It's going to be a lot of public participation to make that happen.
All right. Is Mr. Scott back on the line?
No, Chair Hashtag, he's not.
Does he have the actual call-in number?
Yes, Supervisor Brown, he does.
Thank you.
Okay. Well, my question is, I've heard from people who want to have, in this time of COVID, greater outreach to all segments of the community, especially the Latinx community. So what is your history and involvement to make sure that all segments of the community are represented?
I'm a member of the COVID Response Network that is became active several months ago and has now joined the Latinx portion of our community with those that are English spoken. We have been in contact with the county, with the sheriff, advocating mask wearing, distancing. We're reaching out to the communities and doing really the primary job of protecting this coast. And it's a major effort. There isn't any more testing available on the coast. Masking and distancing is the one thing that is going to keep us sane and whole. And without it, we don't have the, it would overload the Adventist Hospital in Fort Bragg almost immediately. I believe we have about 4 ER beds and 4 ICU, CU beds. So it's a primary involvement. We meet every week to make sure that masks, with a lot of help from NCO, are being distributed, and that people are constantly reminded, pull it up, don't go in the store if you haven't got it. The new regulations that are being spoken about coming out of Sacramento are going to be even more stressful.
Okay.
Thank you.
Thank you. Is Mr. Scott on the line?
Chair Hashtag, I just spoke with Mr. Scott and he will be rejoining the meeting in short order, hopefully.
Okay.
Chair Haschak.
Yeah, Supervisor McCowan.
I would have had a question. What is the most critical issue facing the hospital at this time? I do believe that both candidates have spoken to that in response to the other question, so I have nothing to add. Thank you.
Okay. Supervisor Brown?
Thank you, Mr. Chair, and I hope Mr. Scott gets back on and can finish his comment or response to one of the questions. I am like Supervisor McCowan, but I did want to insert, I know one of the candidates and have for a very long time. The other candidate I do not know, but was impressed with his resume and his responses today. And I just want to say it's fantastic to have 2 very good candidates for this appointment. Many times our districts don't have people stepping up. So I'm waiting to hear Mr. Scott finish his response. And I also, we have 2 supervisors that the hospital, the healthcare district covers their districts. So I also want to hear from them.
Very good. Is Mr. Scott on the line yet?
Yes, Chair Hashtag, this is Deputy Clerk Lindsay Doherty. We do have Robert Scott on the line, and he has now joined us via telephone, so he will need to press *6 to unmute himself to speak.
Okay, Mr. Scott?
Yes, good afternoon again. My apologies.
Okay. I had a question that Mr. Duvall answered. it's in this time of COVID-19 and the disparate impact on different communities and the wide range of communities represented on the coast, especially Latinx. What is your involvement in reaching out to these different communities within the coastal region?
Yes, my involvement is in reaching out to the community, is probably most notably working with two organizations. One is Mendocino Presbyterian Church, where we are a food pantry, where I have the subsidiary operations to the food bank in Fort Bragg. And so we provide different types of resources, food and other financial and in-kind contributions to the less fortunate in our community. The church has been having food for, decades. Also now, there's a strong interest in the Masonic Lodge in Mendocino to provide financial support in the community for the less fortunate. And also, I would say that we've been trying to assist people with the Community First Credit Union. I serve on the board of directors of the credit union, and my responsibility, as I see it, is for our financial institution to provide support for people in the community. We have had a very active program of postponing loan obligations at the credit union for those that were affected for one reason or another by the pandemic.
Okay, thank you.
Thank you.
Any other board comment at this point before we go to public comment? Okay, we don't have any public comment, so it will be back to the board.
Chair Haschak.
Yes, Supervisor Williams.
As others have expressed, I'm very thankful that we have two enthusiastic candidates. I'm struggling with how can we make use of what both have to offer in varying capacities. I see the number one issue on the coast being the sustainability of the hospital operations, keeping Adventist here, because if they decide to pull out at that 3-year mark, or when we don't build a new OSHPD compliant hospital, that'll have economic impacts that will be felt around the county. So I guess in that regard, it's a struggle with two good picks, but I'd like to move approval of them all.
You'd like to move approval of what?
Duvall.
Okay.
Second.
Dave? Any further discussion?
Just that I agree. I think we have two candidates that both know the coast very well. They both have volunteered extensively over the decades on the coast. And I hope that if the board appoints Mr. Duvall to the term, that there'll be that he'll work to see if there's an avenue, maybe on a committee or some other way that Mr. Scott can also continue to volunteer with the hospital.
And Mr. Chair, I'll confirm or concur rather, we have two exceptionally well-qualified candidates. We only have one position. And I do hope both candidates will stay involved regardless of in what capacity. Thank you.
Okay. And certainly I agree with that too. Supervisor Brown, any closing comments?
Yes, I do. I served on the board of directors for quite some time for our local health center, and lots of business. We tried to keep it flying. I did go off the board at one point. We did have money in reserves, change in how both federal, well, they didn't get federal money, state funds to supplement for the most needy within our community that wouldn't have health care or dental care unless we had the health center. But when some of that funding got taken away, the center could not continue. So it to me is a very, very big concern about the Coast Hospital, because certainly we need their services for the locals, but their emergency room, ICU beds, as they talked earlier about. But I wish both men to stay involved because we need that hospital on the coast. So with that,
Amen.
I have no other comment.
Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Chair Haschak?
Yes.
Supervisor Williams?
Yes.
Supervisor Brown?
Yes.
Supervisor Journey?
Yes.
And Supervisor McCowan?
Yes.
The motion carries unanimously.
Okay, and again, thank you both.
And I want to thank the board, and I want to thank Robert. And yes, certainly, we don't want to let that amount of talent stand idle. Just one more comment, if I may, along with the thanks, is that one of the greatest challenges that the hospital prior to Adventist was maintaining OBGYN. And we basically sank the hospital trying to keep that unit open. Adventist, when they took over the hospital, closed OBGYN. If we want to have a healthy community in the future, in all of its aspects, we have to have a complete spectrum in our demographic. And one of our objectives, I believe, must be bringing back OBGYN to the coast. Thank you.
Okay, thank you. It's 3:33 right now. We're going to take a 15-minute break. So we'll come back at 3:48. Right, we're on break now. everyone. So we're on to agenda item 5G, which is discussion and possible action, including authorization to award a contract to Couples and Sons Construction Incorporated in the amount of $3,134,765 for the Ukiah Crisis Residential Treatment Facility project at 631 South Orchard Avenue, Ukiah, California, and authorization for the Facilities and Fleet Division Manager to act as project manager to approve change orders for the project pursuant to Public Contract Code Section 20142. Sponsors Health and Human Services Agency. So I'm going to turn to Allison Bailey, project manager.
Hello, Chair Haschak. How are you?
Fine. And you?
Okay, so Couples and Son Construction won the base bid. Base bid meaning that it was the lowest bid without any of the additional alternatives. And the base bid was, as you said, $2,862,000. So, which was under budget. So very good for us. And the alternates, because we ended up under budget, were suggested and okayed, or at least there was no discussion regarding whether or not we should continue with them because they will benefit the project. And I'll go through those with you. So we have, let's see, the alternative, the first alternative was actually a deduction, and it was for the composition asphalt shingle roof, and we decided not to go with that, partly for fire reasons. And so that they presented that at $13,100. So we are going to go with the regular concrete tile roof. The second came in at $31,800, and that was for a chain link fence at the north parcel. So just to orient everybody, the parcel is on Orchard Avenue, and the north part of it faces the entrance and the exit for the driveway for that Redwood Community Service office. And we won't be building on it, but we don't want people putting trash or tires or any of the other refuse that we took out of there this summer back in that area. So that's what that is for. Number 3 is a gas generator and gas supply. This is extremely important to behavioral health. The Couples and Son came in at $67,965. And I have spoken with PG&E. They are figuring out where the utility is and how large a gauge of supply is going to need to be in order to work with that gas generator. It is in the plans. Knox and Lewis did include it. So that should be a fairly easy addition. Number 4 is a roof-mounted photovoltaic power system. So this is for solar panels. And they came in at $50,000 flat for that. And see, this does not actually include the panels. If you wanted to include the panels, that would have to be something different altogether. But this does set it up so that if the panels are desired, that they'll be easy to install. And then the last one, this is number 5, is an electrical vehicle charging station. This is, and that was for $23,000. And again, this is really just the connection for it. And this is something that the planning department wants all new structures to add into their parking areas. So that is what Measure B and behavioral health, especially concerning the gas generator, would like to include in the construction cost.
So is that it?
That is it.
All right, so let's questions from the board. Let's see, Supervisor Jordy.
Well, so I don't want to take much board time on this. But I'm just thinking about the concrete shingles and then the making of the roof solar panel ready, but for another $50,000. I'm just curious, has anyone looked into whether or not just installing a standing seam meal roof which it can be solar ready in itself, might be the cheaper option, because it's easier. It can be easier to install solar panels on a standing seam metal roof, and then you don't. When you remove the solar panels, if they don't last as long as the roof, you're not creating extra holes in the roof, in the roof sheathing.
Yes, thank you for the question. And it was discussed, though, with Norton Lewis, though there was no actual price or proposal put together, but I could ask.
Okay, I had a question about the solar panel infrastructure and why Couples and Sons is 50,000 and the others are 130 and 180. So are they dealing with the same idea, the same concept, or why is the discrepancy so great?
So I have not checked on, oh, I'm sorry, this is Allison Bailey with Measure B. But I have not checked with their, with the people they are planning on working with, especially on that particular side of the project. That is notable. I don't know if it's just that they have an existing relationship with somebody who is just significantly less expensive, or if that's something that they can actually do partially themselves. I'm not sure if anybody from facilities is on, but if so, then they may be able to help.
Hello, yeah, this is Doug Anderson, Assistant Facilities Manager. Just a point of clarification, correction. The solar option actually includes the installation of the panels. It's not a ready. The base bid included the solar ready. The alternate added the solar panels and a grid tied system for the $50,000. The reason they were significantly lower from my conversation with the contractor is that he's having the electrician who is doing the rest of the electrical work actually doing the solar install. I think the others had an outside solar contractor that was added to their normal electrical scope.
Okay, thank you. And the question is, I guess I'm confused about this. It looks like Doug Anderson, from who we just heard from, is going to be the project manager for this project. So I'm confused about why, Allison, you aren't the project manager for this. I thought that was what the Measure B project manager does.
Thank you for asking, Chair Haschak. When it comes to the finer points of facilities, Doug Anderson from facilities is the person who runs the what happens there on site, and because he is very much qualified to do so, and what I do is all of the corroboration, making sure that the project is working for Measure B and within our within our limits and scope. and doing a lot more of the administrative and organization part of it, not so much the construction.
Okay, so Doug Anderson's time will be charged to the Measure B?
Yes. When he works on a Measure B project, he is compensated.
Okay, is that accounted for in the budget?
That is accounted for in the budget. There is a Munis report that I'm planning to put together to show all of the internal in the internal billing system, who needs to bill and why and what it is that they're doing with Measure B. So that information is coming.
Okay, thank you. Any other questions from the board? Okay, public comment. I don't see any, so I guess we'll go back to the board.
Mr. Chair, are you looking for a motion?
I guess so.
I will move the recommended action.
Okay, is there a second?
I'll second.
Okay, any further discussion?
Chair Haschak, one of the areas where I've struggled a bit with you on the collaboration with you on the Measure B ad hoc is we really wanted to have a business plan of what we plan to do, what the various projects will cost. Assume it won't be perfect, but a good starting point. And I don't know that we're any closer to that now. And we're continuing to spend money. It makes me nervous, but I guess I'm at the point of capitulation. I don't think we're going to have a solid business plan. And I think the only way these facilities get built is we spend. Can you talk a little bit about where you're at?
Well, I think thank you, Supervisor Williams. I think we're at the same spot. I agree with what you're saying is that we've asked for a business plan. We had some questions that were presented to the Measure B project manager at the last meeting, and we haven't received any kind of response to that yet. I worry that we're going down these roads without, clear financials and a vision for how it's all going to fit together. So that's my concern. I agree that at some point we need to either decide we need that financial plan, or we're just going to start going forward with projects such as this, such as a couple others that could be complementary, that could stand on their own without a puff, with or without a puff. And so it's not a good path to be on without having the roadmap for the dollars, because these are taxpayer dollars and we're responsible for them. So. Okay, any further comment from the board? Yeah, Supervisor McCowan.
Thank you. Well, I agree with your comments, and yet I think previous actions of the board, the die has been cast for this action here before us. The board has directed that this, along with the training center and a psychiatric health facility, are the highest priorities for use of the Measure B funds. I think the board going forward will need to focus on the very questions you and Supervisor Williams are raising with regard to a psychiatric health facility. We want to have the most solid information we can about the sustainability of that type of a facility. We have preliminary opinions from our mental health staff that such a facility can operate on a break-even basis. And then, of course, if it doesn't, we do have ongoing revenue from Measure B that to a degree, can subsidize an operation going forward. So again, all appropriate questions, hopefully when the board, prior to the board making any commitment with a psychiatric health facility, you'll have answers to the questions that have been repeatedly asked. But construction of that psychiatric health facility is, by board action, a very high priority. And it's also, I think we had essentially decided at our last meeting, it's also a question of keeping faith with the voters, because that's what the voters expected to see when they voted for Measure B. And comments in response to that action by the board on social media are overwhelmingly in support of a psychiatric health facility being constructed. So again, we need to get the information. We need to make sound, prudent decisions, but that has to be a priority. Again, keeping faith with the voters. Thank you.
Okay, any further comments from the board? All right, so we had a motion, we had a second. Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Williams?
Yes.
And Chair Haschak?
Yes.
The motion carries unanimously.
Okay, very good. Moving on to item 5H, notice public hearing, discussion and possible action, including introduction, waive reading of an ordinance amending chapter 5.140, Mendocino County Lodging Business Improvement District, to modify the boundaries of the district to include the incorporated area of the city of Point Arena, to provide for the levying of assessments on specified hotel businesses within the city of Point Arena. The sponsor is the Planning and Building Services and County Council. Okay, so clerk, has a proper notice been established?
This is Deputy Clerk Lindsay Doherty, and yes, proper notice has been established.
Okay, I'm going to open the public hearing. Okay, has there been correspondence, telephone calls received?
There has been no telephone calls or voicemails received, and no request to speak. However, there were some pieces of written correspondence attached to the item.
And that is correspondence that was received last time we were about to hear it at the last meeting?
It's dated.
Okay.
And I believe, Mr. Chair, this is Supervisor Brown, that this is actually more correspondence that has come in.
Okay. So staff, would you like to present?
Thank you, Supervisors. Good afternoon. This is Adrienne Thompson, Planning and Building Services. This is the third and final hearing related to the inclusion of the City of Point Arena back into the county's bid. I would like to note that we do have a formal written correspondence which is attached to this record from the Wharf Master Inn. County Council and staff are available to address that, and we'd like to do that later after you open the public hearing. Also, I'd like to note that VMC Executive Director Travis Scott should be available, and also the City of Point Arena Richard Shoemaker should also be available on the line, and they've requested to make a couple comments. I'll close my statement as you have my report on file and be available for questions so that VMC or City of Point Arena could also comment. Thank you.
Okay. So is Travis Scott or Richard Shoemaker?
This is Deputy Clerk Lindsay Doherty, and yes, we apologize for the delay. We're just bringing them into the meeting.
Okay, no problem.
Good afternoon, Chair Haschak and members of the board. This is Travis Scott, Executive Director of the Mendocino County Tourism Commission. The commission has been working for 2 years with the City of Point Arena, County Planning and Building Services, the Bid Advisory Board, business owners, and lodging properties to bring Point Arena back into the Lodging Business Improvement District. The inclusion of Point Arena in the bid gives MCTC the opportunity to market Point Arena and its array of tourism assets. It also rounds out the offerings of Mendocino County to our visitors. This addition will allow the commission to present Mendocino County as a whole in our marketing efforts. In MCTC's effort to help our economy during the COVID-19 pandemic, it's important now more than ever to return Point Arena to the Business Improvement District and MCTC's broad marketing reach. Thank you.
Okay, and Richard Shoemaker?
It's actually Paul Anderson with the City of Point Arena.
Okay.
And the City Council in 2019, May of 2019, following the direction of the Point Arena Merchants Association, requested a resolution to the Board of Supervisors to allow the City of Point Arena back into the Business Improvement District. We believe that it's a very important thing for Point Arena to be in the bid. We have not been in the bid for a number of years. We have new lodging establishments, a downtown that is seeking to thrive, and we find that most of the visitor material put out by the county and other areas does not include Point Arena. And there's actually quite a few things in Point Arena that are available to the public, to visitors, including the Point Arena Stornetta Lands, which is part of the California Coastal National Monument, and the Point Arena Lighthouse, which isn't directly in the city limits, but definitely benefits vendors in the city. So there's about 66 businesses that are members of the Point Arena Merchants Association, and most of those businesses would benefit, especially lodging, retail, and restaurants, from having more publicity available. The bid currently promotes every area of Mendocino County except Point Arena. So that is from the south coast to the north coast to inland. Every jurisdiction in Mendocino County is represented except Point Arena. Point Arena Merchants Association and the Point Arena City Council hope that we will be able to rejoin the bid. Thank you.
All right, thank you. Okay, are there any questions from the board?
Mr. Chair.
Yeah, Supervisor McCowan.
Thank you. I would request a report on the bid protest. We did receive at least one protest. It's my understanding that was not sufficient to carry the day, but I think we should have that in the record.
Okay.
Deputy County Counsel Matthew Kudrowski. This is the public hearing on the addition of Point Arena to the bid. We've had two public meetings, one public meeting prior to this, plus the initial resolution of intention. The agenda summary goes over the written protest procedures and what's required for that. What's required is that if written protests are received from the owners of businesses, which will pay 50% or more of the assessments proposed to be levied and those aren't withdrawn, then no further proceedings to modify the bid shall be taken for a period of 1 year. The county did receive a written protest from one hotel operator. We'll also have to have public comment on this item. I don't believe any telecomment has been submitted. But the operator, which operates the Wharf Masters Inn, represents 26 of the 59 rooms in Point Arena. To determine the Wharf Masters Inn's approximate share of assessments, we reached out to the City of Point Arena for information related to the city's own transient occupancy tax. The city's tax is also based on a percent of the room rate, similar to the imposition of the assessment under the bid ordinance. The last 12 months of TOT data were provided by the city to the county, and over the entire 12-month period, Wharf Masters Inn was over 50%. However, Streets and Highways Code section 36525 requires a review of whether protests were received from the owners of businesses which will pay the assessment, which is prospective. Based on that wording, we believe that the statistics of the most recent financial quarter provide the most relevant information. And during that most recent quarter, a new hotel opened in the city of Point Arena, I believe on June 12th, and I can ask staff to confirm. And during that quarter, the Wharf Masters Inn's share of TOT was 44% of all the TOT paid to the city, which is below the 50% threshold for majority protest. So based on that most recent information from the city of Point Arena and the fact that the bid assessment is prospective, staff does not believe there's been a majority protest of the bid expansion. And following public comment, I can read into the record additional language that I would recommend adding to finding 1 of the ordinance related to that.
Okay.
Any questions, please let me know.
Thank you. Are there any further questions from the board? I'd just like to note that I appreciate the fiscal details that number has been updated to the current fiscal year cost to be $30,000, which is a county match estimate. So it was different last time, and I appreciate that change. Any other comments from the board?
Mr. Chair?
Yes, Supervisor Brown.
I would like to hear from the 5th District Supervisor and his opinion.
I'm in favor. For all the reasons stated. It's good for Point Arena. It's good for the county.
Thank you.
Okay.
Chair Haschek.
Yes.
Thank you. So this, the Business Improvement District used to be very controversial. We had organizations dedicated to the same mission, but with some degree of rivalry between them. And it was a difficult situation that caused our bid effort to always operate under somewhat of a cloud. Several years ago, to their credit, those organizations came together, supported a plan to have a unified approach to promotion. And at the county level, Supervisor Jurdy and I assisted in helping those groups reach that agreement that the board then approved. Unfortunately, at that same time, there was a concerted effort to invalidate the Business Improvement District, to dissolve it. That effort ultimately was successful in Point Arena, not in the rest of the county jurisdiction. So we've had this hole in the donut situation with Point Arena, and it's, I believe, beneficial not just to the city of Point Arena, to the county of Mendocino, but also to the lodging facilities that are in Point Arena, including the one that submitted a protest. I'm very gratified that the other lodging operators within Point Arena see the wisdom of rejoining the unified promotional effort. Point Arena, obviously, I think has a lot to add with its proximity to the Stornetta lands, but just on its own, there's many great attractions within the city of Point Arena. So I think this is a somewhat long overdue, but very welcome step forward. Thank you.
Okay, any further questions from the board? Okay, we'll go to public comment. Deputy Clerk, are there any public comments?
No.
Okay, so we'll go to staff present final remarks. Staff, do you have any final
Thank you, Supervisors.
comments?
Adrian Thompson, again, I'd like to pass it to County Council to read the modification to your ordinance briefly. Thank you.
So Deputy County Council, the ordinances that was provided to as part of the agenda packet, I would like to add additional language to section 1, and I will provide this in writing to clerk of the board following this item. It's immediately following section 1, I would add a kind of a header, lack of majority protest, that would be underlined. And then the next 2 sentences would read, a written protest was received by the operator of one hotel, which hotel represents approximately 44% of the total amount paid by all hotels to the city of Point Arena under its transient occupancy tax during the July to September 2020 financial quarter. The assessment imposed by the bid is a percentage of the rent charged by the hotel, similar to the transient occupancy tax imposed by the city of Point Arena. And that finding would then continue, as it currently states, that the board finds and determines that protests objecting have not been made by a majority. The addition is meant to just bolster and acknowledge the fact that protest was received, but it was not deemed to meet the 50% threshold.
Okay, thank you. Are there any further questions from the board to staff or public? Okay, I'm going to close the public hearing.
Chair Hashtag, would you entertain a motion?
Yeah. The matter is before the Board of Supervisors. Public comment is no longer permitted, and it's before. I'm looking for a motion.
Chair Hashtag, I move we introduce and waive reading of ordinance amending Chapter 5.140 Mendocino County Lodging Business Improvement District to modify the boundaries of the district to include the unincorporated area of the city of Point Arena, to provide for the levying of assessments on specified hotel businesses within the city of Point Arena.
Second.
Okay, it's been moved and seconded. Any further comments from the board?
Sorry, Deputy Counsel, if I can just clarify, that includes as modified at today's meeting?
As modified at today's meeting.
Thank you.
Okay. Any
And the
further
second
comments?
concurs.
Okay, hearing none. Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams?
Yes.
Chair Hashtag?
Yes.
And Supervisor McCowan?
Yes.
The motion carries unanimously.
All right. Moving on to item 5I. Discussion and possible action regarding Department of Transportation Director's approval of rate adjustments for solid waste collection area number 2, Fort Bragg and Ukiah areas. Sponsor is Transportation Department. So is Howard DeShiel on the line?
Chair Hashtag, he is. We just need a moment to transition.
Very good.
So good afternoon, Mr. Chair, lady and gentlemen of the board. This is Howard DeShield, your solid waste director, or Department of Transportation, I guess, for today, solid waste. On September 21st, 2020, Waste Management submitted a rate increase notification to Department of Transportation, which raised franchise area 2 inland rates by 22.83%. and franchise area number 2 coastal rates by 18.74%, effective November 1st, 2020. The reason for the drastic increase is that Waste Management has not increased their rates since 2018, and there have been significant increases in recycling costs since that time. The increase also included cost of living and fuel adjustments for 2019 and 2020. In October 2018, a rate adjustment request were submitted to Mendo Recycle, which was the county's previous contract solid waste director. However, they were without a general manager at that time and did not respond. As a result, these will be billed retroactively to January 1st, 2019. However, Waste Management has confirmed that the back charges are able to be split over 2 billing cycles to lessen the burden to customers. MDOT's contracted solid waste director, which is HDR, Mr. John Carlson, our consultant, did analyze those rate calculations that were submitted by Waste Management and did confirm they were calculated in accordance with the terms of the franchise agreement. And per those terms, the county was obligated to accept the rate adjustment based on the analysis. A letter was sent by Waste Management to their customers in mid-October to notify them of the increase. I would add that I do have Mr. Carlson here to answer specific technical questions about the rate increase. I would also add that, a 22 to 18% increase was rather shocking to many of our citizens. I know there are 5 public comments that were sent in on this item, and they resemble some 30 calls that I did receive, and I acknowledge that that was a rather large impact to our citizens and waste management customers. And I would add that it's my hope and my goal to never allow, the missing of an important rate increase so that we don't get put in this position in the future. With that, I will take any questions.
Okay, Supervisor Williams.
Can you tell us when the county entered into the contract that allows the retroactive rate adjustment?
Oh boy, first off, he hits me. I think that, well, Waste Management has had Area 2 pretty much since the 90s, but I think the last contract goes back to like 2004.
Sorry, Director DeShield. This is Christian Curtis, County Council. Mr. Chair, I happen to have the agreement in front of me. I could answer if that helps.
Yeah, go ahead.
Yeah, and Director DeShield is correct. The current iteration of the contract was entered into in 2004. There have been a few amendments since then, but the controlling language appears to be in the original document.
So as I understand from talking to staff and talking to the council prior to the meeting, under our agreement, they do have the right to increase as they have. What's not as clear is whether they can collect from their customers. This is an area that's outside of the scope for county council. So certainly we're not going to offer an opinion today on that. But I've been hearing from some constituents who have not had waste management service for the 2-year period. Some of them only for a matter of months, and yet they've been billed retroactively for 2 years. If I were in that position, I would look very closely at the bill and the terms that I agreed to.
Thank you, Supervisor Williams, because that has also been my experience. And actually, this is not the first time issues have come up about waste management where customers have had difficulty reaching someone in charge just to discuss service and costs. Howard mentioned the number of emails, calls. I got more emails than I'm sure he did, but this has been a very, very hot subject. And on this issue, notice to customers was only received 12 to 15 days before the increase was implemented. And the retroactive fees were charged to many that didn't even have the service during the retro fee charges. That's very concerning. We also are in a pandemic where families have financial strain. Many of them probably will have unemployment and employment money that salaries that they won't be receiving. But during a disaster, I look at this as price gouging during a disaster. Waste management really needs to think about this. The retroactive, I think, is the price gouging that I really see. The percentage of the rate increase did not give customers time to decide if they wanted to keep the service. And I would rather try to work this out for these families and those receiving the service without having to go to court. And then I want to know when this franchise will be reviewed by the Board of Supervisors in the future.
Well, I can respond to that through the chair if you'd like.
Yeah, Director DeShield.
So Waste Management did tell us when customers who had not had service during the time of the retro were charged, that if they contacted Waste Management, that error would be corrected.
And actually, several said they did try but they couldn't reach anybody that would do that.
All right. Well, they told us that they would do that. As far as when this franchise agreement is up, it does come up in June of next year, so roughly 7 months from now. And, you know, we'll have to make a decision on how we proceed. And that would come to the board either as a authorization to bid or a authorization to negotiate an extension. But something will have to happen in the next 7 months.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. I share the concerns of my colleagues. From a legal standpoint, I believe there are serious questions about whether the retroactivity of the increases is legal. And I think that should be explored. The company is relying on, gosh, we made the request. The county seems to have dropped the ball. We need to have this approved anyway. This is in contrast to an earlier situation where this contractor began charging overage charges to their customers. And that was a situation that came about when they submitted information to our then contractor, who lacked the expertise and the knowledge to appropriately review it. And it resulted in a situation where the board inadvertently approved these overage charges based on the representations of the company that it was simply reinstating charges that had previously been approved by the board via a contract amendment. In fact, the board had never at any previous time approved these overage charges. I don't think the company can claim the benefit of, well, gosh, your staff didn't do its job there, give us the money anyway, and say, well, you know, it's not our fault, your staff didn't do its job on this other occasion. I think there's legal issues around that one as well. I think this issue is more appropriate for a closed session discussion rather than any approval today. And it only deepens my concern when I hear that there are people who only recently signed up for the service that are getting hit with these huge retroactive increases. I can't in any way support this item.
And I would like to say I cannot either.
All right, we will, you know, certainly it's troubling to think about retroactive people who didn't have the service being charged for this retroactive agreement when they weren't even part of it. So, let's go to public. Yeah, Supervisor Williams.
Yeah, I could use clarification from Supervisors McCowan and Brown what they mean when they say they won't support this item. As the only recommended action is to receive a presentation, and we have the option to, I guess, give the director some direction. Do we want to direct that this come back to a closed session?
I think that it should. This is Supervisor Brown.
Chair Haschek, I guess I'd be ready to make a motion after public comment.
And if I may, I agree with that statement. This needs to come back in closed session. And then, you know, it's odd too that we're approving the director's approval. I believe the normal course of action, the director would have brought this forward initially as an action for the board to approve prior to the rate increases going into effect. So I think the process may have been a little bit backward here as well. So, but I support the concept that this would return to the board in closed session. Thank you.
Chair Haschak.
Yes,
Do
Supervisor Williams.
you need a motion, or as chair, can you direct that this come back in closed session?
Well, I'm going to public comment right now. And then we'll figure it out. Okay, so we do have a public comment. Is Devin Jones on the line?
Yes, good afternoon. Thank you, Board. Devin Jones, Executive Director at Mendocino County Farm Bureau. And I won't take your time this afternoon. Most of our points were reiterated in the conversation that just occurred. The one point that was brought up in one of the comment letters, not ours necessarily, but it is important to consider in the rural areas of this county, is the fact that, if some of these fees continue to increase dramatically, we could see folks start to resort towards illegal dumping types of activities, which has always been a bane and a burden on agricultural types of properties. So that's just something else I wanted to bring to your attention. So I appreciate the comments. My phone started ringing off the hook last week pretty substantially on this. Since we are not in the county within the waste management district, I did contact them and they did provide me with the letter sent out to their contractors. However, I do appreciate the board taking action on this to bring it back for additional conversation. So please listen to the concerns that were brought forward today. Thank you so much.
Okay, thank you. So seeing no other public comment, we'll go back to the board. And Supervisor Williams, would you like to make a motion to have this come back?
Chair Haschak, do you need a motion, or can you direct as chair that it come back?
Let me go to County Council.
Thank you, Mr. Chair. I believe as chair you could direct this come back. I don't want to give any sort of false impression as to what action might exactly be able to come out of closed, but it's certainly a matter that I might be able to appropriately brief the board on in closed session. And if I could just a little bit go to Supervisor McCowan's comment. There was a question about the sort of the order being backwards. I just want to clarify, under the agreement, there's about 3 different types of rate increases under 15A and 15B. I believe that the rate increases have to be approved by staff if they meet certain criteria. Under 15C, there's a 3rd type of rate increase that has to come before the board and be approved by the board pursuant to a public hearing. My understanding is that this is just the types under of rate increase under 15A and 15B, not the type that would go to 15C. So my understanding, and Director DeShiel might be able to speak to this, is that's the reason it's on for receiving information rather than for the board taking some sort of action to approve.
Yes, Howard DeShiel through the chair. These were the routine type increases. The only portion of this that wasn't routine would have been the MCERA pass-through that was done last fall, and that's wrapped up in this as well. But the rest were just the normal staff. The contract doesn't permit staff to process as routine.
Okay, thank you. So
Chair Haschak.
Supervisor Jurdy first.
Yeah, so understanding that we often have limitations on what the scope of what we can discuss in closed session, I just wanted to put out there some other concepts. We were talking about direction to staff on the new contract that will need to be in negotiations in the next several months. And so clearly this brings to the attention of everyone the fact that there's some gaps in the current contract. In my mind, that there needs to be some sort of equity and responsibility on both parties' part if a rate increase is justified, that the operator needs to show some, I would say, multiple efforts to get that rate increase, if justified, approved in a timely manner, and not just let it drag on. And the other is that notification to the ratepayers needs to be something that's a letter that's approved by both not only the operator, but approved, I would say, by the county. Because when I saw a copy of the letter that went to county residents, to me it was at best confusing and maybe a little bit misleading. And so anyway, those are just some thoughts because I do think we need to be looking at this in two directions. One is a future closed session item, but the other is to make sure that we think through what we want in any future contract.
Okay, Supervisor McCowan.
Well, thank you, Mr. Chair. And I would go a bit further than Supervisor Jurdy. I think we need to have an agenda item for the board to give direction whether we wish to negotiate renewal of this current contract or go out for bid. The current contractor has held this contract for many years. It was renewed approximately 7 years ago based on, they made a one-time payment both to the city of Fort Bragg, to the county of Mendocino as an inducement to extend the contracts. I think in fairness to the ratepayers, it may well be time to put this out for bid and see what the market says. I do believe there's at least one other solid waste operator that's well qualified and may well welcome the opportunity to submit a bid. I think we're shortchanging ourselves and the ratepayers if we don't put this out for bid to see what is available. So again, I strongly urge that we have an agenda item to allow the board to give direction. There are indications that I've gotten that staff was intending to put a neat little bow on a contract renewal, and I don't think that's appropriate. Thank you.
Okay, any further comment from the board?
This is Supervisor Brown, Mr. Chair.
Yes.
I would recommend that, the board be fully involved as Supervisor Jurdy expressed, and that we do go out to bid and go out to bid in a time well before the renewal is up to see what will be coming back.
Okay, I think that what Supervisor McCowan was saying was that it sounds like we should go out to bid, but we need to do that with a separate agenda item because this is just dealing with the rate increase.
That is correct, but I'm also worried about the time frame for service for people. And if this is up in, I think Mr. DeShiel said June, July, I think the bid process, we're going to need lead time.
Okay, well, Director DeShiel, with what kind of lead time do you need for if this were to go out to bid again?
Well,
When should
Mr.
it be
Chair,
brought up?
again, Howard DeShield, Director of Transportation. We already have asked our contract solid waste director to work on language for a modern, up-to-date franchise agreement because there's been quite a few changes in the law as well, and that is proceeding. Whether we were to go to bid or to do a extension certainly needs to come to the board. I might add the CEO recently asked me to agendize not only this issue, but it does relate somewhat to the rest of some other solid waste issues, mainly around how we do long-range planning in Area 2, this area, particularly the coastal area, where we, concurrently use the same services as the city of Fort Bragg. My intention was to put together a large item that includes the various solid waste issues and components for a broad board discussion and direction. But we're already working on what would be a new contract for next year, be it bid or be it extension.
Okay. So that will be coming back to the board at some point in the near future.
Yes.
Very good. Okay. So I'm going to use my chair discretion to have this item 5I come back to the board in closed session at the soonest possible time. All right. Okay, so moving on to item 5J. Discussion and possible action, including adoption of resolution amending the position allocation table as follows. Sheriff's Office Budget Unit 2310, add 1 FTE Administrative Services Manager 2, 1 FTE Program Manager, delete 1 Sheriff's Business Services Officer. Sponsor is Human Resources. Okay.
Good afternoon.
Mr. on the line.
Good afternoon, Chair Hashtack and members of the board. This is William Schertz, Human Resources Director. I would like to introduce Human Resources Manager Johnny Cranmer to provide a background on this item.
Good afternoon, Chair Hashtack and Supervisors. This is Johnny Cranmer, Human Resources Manager. This item, it addresses the change to the position allocation table of the Sheriff's Office to add 1 Administrative Services Manager and 1 Program Manager, and delete 1 Sheriff's Business Services Officer. As part of the budget process in 1920, on June 5th, 2019, the Board of Supervisors approved the deletion of 2 management level allocations, the Admin Services Manager 2 and a Program Manager, and the addition of 1 Sheriff's Business Services Officer. The intent of this action was to create efficiencies through the combining of the administration, fiscal, and the professional standards units. The reality is that both of these areas have a very large scope of work and a high level of responsibility. With the recent retirement of the Sheriff's Business Services Officer, the department now believes that the best course of action is to revert back to the 2 units, each with its own manager. The 2 positions are mission critical to the effectiveness of the Sheriff's Office operations. The Administrative Manager 2 is responsible for the overall day-to-day supervision of the Sheriff's fiscal unit, including payroll, accounts payable, accounts receivable, purchasing, jail commissary, contract management, grants management, federal and state and other revenue source funding, internal and external fiscal reporting, and budgeting of the Sheriff's Office $35 million annual funding. The Program Manager is responsible for the Sheriff's Office hiring of all of their 187 allocations, including post-mandated background investigations, post-mandated training, and personnel records and compliance. Therefore, the item calls for the deletion of the Sheriff's Business Services Officer and the addition of 1 Administrative Services Manager 2 and 1 Program Manager. The cost associated with this action is partially funded through the Sheriff's Business Services Officer allocation, which was funded through fiscal year 2021 and has been vacant since October 17th. This results in an unbudgeted increase of approximately $33,219 for the remainder of this fiscal year. The department believes they can absorb the amount through salary savings for the fiscal year, and they will work with the budget team if they do need an adjustment, and as well as for funding for next year. And I'm available for questions, as I believe Under Sheriff Brewster is also. Thank you.
Okay, are there any questions from the board?
I have a question.
Okay, hearing none. Supervisor Williams.
Yeah, it's when I look at the allocation table, it looks like the Sheriff's Office is very admin heavy compared to historic. Is that just another way to say we're short on deputies?
Supervisor Williams, was that directed towards me? I can answer that.
Yeah.
So it's, I don't believe, well, we
I'm
are
sorry,
very-
I need to interrupt for a moment. This is Deputy Clerk Lindsay Doherty. Can you please state your name for the record?
I'm sorry. My name's Darren Brewster. I'm the undersheriff for the sheriff's office. Supervisor Williams, we are very short deputies. And as far as the admin positions go for what we're requesting, that's the way the sheriff's office had always run until 2019, where a unique, we were able to get a unique person with his expertise to be able to run those two positions. It's daunting to have even somebody with his standards to run those positions. So when he retired, it was mission critical for us to change back to the administrative services manager and the program manager.
Got it. Thank you.
Any other questions from the board? Okay, hearing none. Public comment, I don't see any. Back to the board.
Chair Haschak, I move the recommended action.
Second.
Okay, second, Supervisor McCowan?
Yes.
Okay. Okay, any further comment? Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
Supervisor Jurdy?
Yes.
And Supervisor Williams?
Yes.
The motion carries unanimously.
Okay, thank you. Okay. Item 5K, discussion and possible action, including adoption of resolution amending the position allocation table as follows. Planning and Building Services, Budget Unit 2851, add 1 FTE Assistant Director for Planning and Building Services. Sponsor is Human Resources. Okay. Back to you, Mr. Schertz.
Thank you, Chair Haschak. This is William Schertz, Human Resources Director. Once again, I'm going to indulge you with to have Johnny Cranmer, our HR manager, to provide the background on the Assistant Director position. Johnny?
Thank you. Good afternoon again, Chair Haschak and Supervisors. Johnny Cranmer, Human Resources Manager. This item addresses the possible action, including adoption of a resolution amending the position allocation table to adopt and add an Assistant Director of Planning and Building Services. At the request of Planning and Building, Human Resources has prepared the proposed classification of Assistant Director of Planning and Building Services and the accompanying resolution to adopt the new classification at a salary of a range of $101,171 to $122,948 to amend the position allocation table to add 1 full-time FTE, Assistant Director of Planning and Building Services. Planning and Building Services has experienced an exponential increase in assigned board directives, priorities, assignment of new operations, and demand for services, resulting in an exponential increase in director-level decision-making, policy implementation, and county code changes. The inclusion of the Cannabis Permitting Division, Cannabis Equity Grant, Code Enforcement, Health Order Enforcement, and increase in permit activity has significantly increased the workload of the planning staff and the director, making it critical to add an assistant director to manage and organize the department, develop new operations, complete assigned board priorities, and handle high-level decision-making. The Assistant Director of Planning and Building Services will be an at-will, exempt from civil service, and in accordance with Resolution 18150 will be unrepresented by bargaining unit. The recommended salary of $122,948.80 at step 5 is aligned at approximately 25% below the Director of Planning and Building Services. If this proposed classification is approved, the increase is negotiated in the current Department Head Association MOU slated for September 2021 should be applied to the Assistant Director of Planning and Building Services, concurrent with the Planning and Building director in order to maintain the alignment established through today's action. The item calls for the adoption of the assistant planning director and the allocation of 1 FTE. The fiscal impact for this fiscal year is an increase of approximately $124,125. This includes the cost of benefits for the remainder of the fiscal year. The department has indicated that they believe they can absorb the cost of the allocation through the remainder of the fiscal year and will work with the budget team, not only for the remainder of this fiscal year, but for next year as well. I'm available for questions, as is Planning and Building Director Brent Schultz. Thank you.
All right, any questions from the board? Supervisor Jordy.
So, I mean, I want to support this. I mean, we know we need some additional staffing in the department, but I'm not really sure that I'm sold on the idea of creating a deputy department head in the planning and building department. I'm wondering if there's some other model. I mean, you know, we have one chief planner. We have, I think at the moment, only one senior planner. We historically have had a senior planner on the coast and a senior planner in Ukiah. We, at this moment, just have one senior planner. I'm just wondering if we would be better off with 3 senior planners in addition to the chief planner, and that might be, you know, a better strategic use of staff resources.
Any other comment from the board? Okay, seeing none, we'll go to public comment. And I don't see any public comment, so it's back to the board.
Move the recommended action.
Second.
Okay, is there a second? Okay, it's been, okay. So it's been moved and seconded. Let's see, any further comment? Okay.
Well, yes, Chair Haschak, I think there's something to what Supervisor Jordy is bringing up, and I don't want to overlook that. But I think we need to remain competitive and retain talent. And when I look at neighboring counties and, you know, cities within a couple counties, I don't know that we're necessarily competitive. And I think this is potentially one way we can ensure that we retain talent.
Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Jordy?
No.
Supervisor Williams?
Yes.
Chair Haschak?
Yes.
Supervisor Brown?
Yes.
And Supervisor McCowan?
Yes.
The motion carries with Supervisor Jordy dissenting.
Okay, agenda item 5L, Chief Executive Officer's report.
Thank you, Chair
CEO
Haschak. The board should have the report from this afternoon. Anyway, I will go ahead and start, and in the interest of time, go through this as quickly as I can. Page 1 is our human resources update. I had talked about the departments being affected by COVID, and you can see some of the statistics that are here on this first page. And again, not only do we have employees that are COVID positive, but we have employees that are in quarantine due to being exposed. And then we also have employees that have child care issues. So you see some totals here before you. On page 2 of my CEO report, we continue with the human resources update, and it is open enrollment for our health plan. So what's important there is that second to the last paragraph about due to COVID-19, all forms required to make changes must be emailed to Employee Health Benefits, and the email is there. And the date is Friday, December 4th. So for county employees, if you plan on making any changes to your health plan, you have until December 4th. Again, the vacancy list is attached. That has been at the direction of this board, and it is on the CEO report monthly. The COVID-19 update was given by Dr. Corin this morning. I don't really need to focus on that. This really talks about us being in purple and the fact that Mendocino County jumped up our cases jumped up by 69%, which is overwhelming. Last night, we did a virtual town hall with Senator McGuire. This board has asked about this town hall. They've asked about community meetings as well. And what we've said is that the town hall with Senator McGuire would be the kickoff. We did that last night. As you can see, we called it Coming Together on the Homelessness Crisis. Chair Hashjack was there with Senator McGuire to open up the town hall. We also had Mayor Doug Crane, City Manager Sage Sanjacobo, and myself did part of the town hall. And then we had our resident expert on our Best Western project, Megan Van Zant, who answered a lot of questions around Project Home Key and the Best Western project. We had over 100 people who Zoomed in. You can see in the second paragraph the speakers that we had. We had Jeffrey Ross, Assistant Deputy Director of Housing and Community Development, and he talked about our project, and he talked about his staff, about HCD visiting and thinking that the facility is optimal and the location is a good location because it is around services. And then we also had Paul Fordham, who's Deputy Executive Director of Homeward Bound in Marin, and Paul Fordham and Megan Van Zant did a session together last night, but they also have been talking about what they're doing in Marin, which is considered a gold star program for permanent supportive housing for homeless to transition. And so they are working together. And so there are some similarities to the concepts that Ms. Van Zant has and to the Marin County program. Last, what we did is we agreed to some actions, and one being, again, that this would be the kickoff, not the end, and that we would be scheduling a community meeting soon. We also agreed, and Supervisor Hashjack may want to speak to this a little later, on a 2x2 committee. And what's happened in other counties is city and county representatives have gotten together. The committee is called 2x2. It's basically an ad hoc, 2 city council members, 2 supervisors to discuss an issue or work through a problem. And so we would have a 2x2 committee, and we could bring that forward to the board either in December or in early January, and it would be to form an ad hoc to work on the issue around homelessness and also around our Best Western project. So I think that the town hall last night was a successful town hall. I think we got a lot of information out there. It was an hour and a half, and again, it was a kickoff, not the last meeting that we're having. We have a few months to actually plan. I think one of the key issues was delineating what the Best Western project is as compared to a homeless shelter, and also what the concept of management is. And there seem to be questions from members of the public around management of the facility. And we clarified there is case management, which will be run by program staff, and then there's management of the overall facility, and that we will go out for RFP to get the best vendor that we can find to manage the facility. So again, we had a lot of questions, and I would say that there really were very few comments that were in the negative about the project. And my hope is that as we continue to speak with the community and to put more information out there and to have the community give their input on what Best Western will actually look like, that there will be more community support. So I would like to thank Senator McGuire for the work that he did in not only assisting us with the dollars that we received from the state, but also assisting us in working with the city and working with the community. Page 4 of the CEO report is around requests for proposals and requests for bids. You can see that we have something out for generators, and then of course the crisis residential facility And the sheriff has an RFP out for jail food. So those are some of the bids that we currently have out. There is an ag update. I won't go into this too much except to say that it sounds like our ag department is doing what they do and working through the close of the departments for the pandemic. They are taking appointments and people are coming in. They are serving their clients. And then Health and Human Services does have an update attached and board directives. I would like to say again that how we do board directives is during the board meetings, the clerk of the board records the various consensus decisions. And again, the operative word there is consensus. There are times that one or two supervisors may say something and think it's a directive. We really look for consensus of the board and the approval of the chair to consider it a real directive. So the clerk of the board will record the consensus decisions or legislative actions that direct county staff and other agencies to follow up, research on certain topics and issues. And then the executive office does maintain a tracking mechanism of all directives with a status as to completion and necessary steps to follow through. We notify a department if a directive goes to a department and that department does the directive. So we follow up and mark it as either completed or in process when we get that information from the department. And again, there is a list of the draft list of all the current directives as of November 3rd, and that is attached to my CEO report. Cultural Services update, you can see the three areas in the Cultural Services update, and they are in the process of interviewing a chief librarian. That is, again, still in process. There's an Animal Services update. Again, Rich Molinari and his team do a great job, and you can see the update there in front of us. And then on page 8, we have 2 board meetings for the rest of the year, December 8th and December 15th. And of course, we have our county holidays, November 26th and 27th, and then December 25th. There is a press release that is going out again that talks about the closure of the county buildings on certain days, specifically November 26th and 27th. And then, of course, as we've done every year now, the departments can do a winter holiday closure. They can close to the public, not close to the public. They can have staff in the office, not in the office. It's a little different this year because the county departments or the county buildings are shut down. And as we surge into purple, we will be shut down through the rest of this month and next month. However, again, we do put out a press release because we do want the public to know who's open, who's not, and also all of our 24/7 services and emergency services are open and people are available. The attachments, I won't go through this. You can see what the attachments are, and there is the press release from yesterday, which placed Mendocino County back in purple, and also what that means. So with that, that is the end of my CEO report, Chair Hashjack, unless there are any questions. And there is no legislative report today.
I had a question on page 4 about the RFQs.
Yeah.
And why
Yes.
is the RFQ listed?
I'm sorry, Chair Hashjack, I didn't hear your question.
Oh, that on page 4 with the RFPs and RFQs.
Yes.
And my understanding is that there's RFQ out for the PUF that we're waiting on.
Chair Hashjack, Janelle Rao, Deputy CEO. That was issued at the department level. We can verify you are correct that that is out, but I do believe that these are RFQs or RFPs that are issued by the executive office only.
We can have a follow-up at the next meeting, Chair Hashjack, if you'd like.
Okay, because my understanding is we're supposed to get the results on, I think the deadline was the 19th for that.
Yeah, I'm not sure what the
other
deadline
thing-
is.
CEO Angelo, you said that for the Cultural Services Agency, we were looking to hire a chief librarian. Was that correct, or are we looking to hire a department head for the CSA?
We are looking to hire a CSA director. And I look at that person as the chief librarian. So that is a slip up on my part. Shows my bias, I guess. But we couldn't hire a cultural services agency, the director that, didn't understand library. So my apologies for my mistake. It is a CSA director.
Okay. And I've also heard talk that the Parks Department or Parks might be split off from the CSA. Is there anything you could say to that?
We have a real challenge with our parks. Yes, we're not certain what the plan is for the parks, but I assure you that if the parks are moved, or if there's a discussion to move the parks out of the Cultural Services Agency, that will be a discussion with this board. The challenge with the parks is that wherever we put the parks, it doesn't matter unless we put resources with those parks. When we had the parks with facilities, with general services, there was 1 to 2 employees that worked in those parks. So you really didn't have the ability to build out, be creative, apply for dollars, try to keep the upgrades going in those parks. And so we took the parks, we moved them to the Cultural Services Agency, moved them with the library and the museum in hopes that we would have economies of scale with all 3 of those services and really begin to work with the parks. And as this board knows, the decision was to work on an assessment with the parks because once we had a written and current assessment, that could help us apply for money. But the board did not approve all of the steps going forward with the assessment. So we had to stop the assessment because there was no approval for money to move forward. So where we are with the parks is they are still with the CSA. We do not have staff that are really working on the parks, and it is a challenge. So what would be good would be to have a discussion with this board about the parks and really look at putting resources into our parks. And if we could look at those parks, and right now everything's pretty much shut down or will be. So, we have time to talk about this, but to have these parks, do we want to look at them as part of our economic development? It brings in tourism. Is that something that we want? Along with building out these parks just for the 90,000 people that live here. And, it is a desire of the staff that we put resources into these parks and that we finish the assessment so that we could apply for state and federal and private funding for these parks to build them out. So long answer to a short question, but we really would like to have the discussion about the parks and the support for the parks, and we plan on bringing that topic back to this board after January.
All right, thank you. I really appreciate that. Any further questions from the board? Yeah, Supervisor McCowan.
Thank you. CEO Angelo, on that last point, I thought until very recently, we did have a person employed with regard to the parks. Is that person no longer in that capacity for the county?
Supervisor McCowan, I cannot answer that. I can certainly follow up and bring that information to this board at the next meeting. I'm not certain. I know that they had one staff person. Initially, it was Megan Duquette who left, and then I know they hired somebody else, but I'm not certain what happened with that one position. But I can let this board know at the next board meeting.
Thank you, or just an email probably would be sufficient. One other item, and I appreciated your report on the town hall meeting with Senator McGuire. Not surprisingly, Senator McGuire was very energetic and engaged. He brought some great co-presenters with him from the state, and the gentleman from Homeward Bound, I believe. Program manager Megan Van Zant did an excellent job responding to questions She has I think, a very direct manner at some point that I think is very effective and engaging. So I do think that town hall, although it did not answer all questions, it answered many questions. And I think it went a long way in providing the answers that in a more ideal situation where we had the advance time to engage the community would have been answered up front. I thought it was very well explained, the time constraints and why there wasn't time for a drawn out community process prior to moving forward with the project. However, in reviewing the directives, the Board of Supervisors previously directed that subsequent to Senator McGuire's town hall, there would be an agenda item for the Board of Supervisors with the ability to attach conditions to the project. And of course, there were statements about various conditions that the staff does intend to apply to this project. It's obvious staff has really thought through every aspect of this. However, there was previous board direction for an agenda item before the board where the board could hear from the public and potentially impose conditions on this project. I don't see that on the list of directives. Is that just an oversight?
So Supervisor McCowan and through Chair Hashjack, my understanding of that discussion with the board was that we would be working on the town hall with Senator McGuire first before we took any other action. So any community meeting would be after the town hall. I also thought that based on the discussion, part of the discussion was around you, Supervisor McCowan, talking about putting conditions on the project. We know that the funding for this project has its own limitations, and that along with those limitations is that there not be multiple conditions on this project for this money. Additionally, there has to be a movement on this project that I believe there's a time frame of like 3 to 6 months. So to answer your question, I did not think there was an actual directive as you are stating. So we could go back and listen to the board meeting. There was discussion about it. I didn't think that we had a directive. I thought that there was agreement that the town hall would be the first. There would be community meetings after that. The board would participate in those community meetings. If this board chooses to have a Board of Supervisors meeting on this project rather than a community meeting first, I'm certain we can do that. But I would need a directive from the full board. And my understanding was that this board wanted community meetings as soon as possible. So we are already working, Megan and myself, and we've actually talked with Camille Schrader from RCS because there is a lot of confusion between building bridges and the Best Western project, that possibly with the first community meeting, we would include Ms. Schrader and RCS and talk about the different services. And our hope is that we actually have a community meeting scheduled within the next 2 to 3 weeks. So I guess at this point, I would ask the board for direction. Can we move forward with the community meetings knowing that the Board of Supervisors could join us? Would you like us to hold off and have a Board of Supervisors meeting first? If you want to put conditions on this project, and I'm not talking about saying we're going to have a 24/7 security guard. We know that. We know we're going to have staff there 24 hours a day. We know that we're going to have someone picking up the trash around the yard. We know that there are things that are just make a lot of sense that we're going to do. But if this board specifically wants to put conditions on this project, then we would have to come back to this board, and we would also have to check with the state to determine that those conditions that this board directed were actually in alignment with the state requirements for the money. So at this point, Chair Hashjack, I would ask for direction. Thank you.
Well, if I may, Mr. Chair, I believe the board did give direction, and the direction was there would be an agenda item before the board after Senator McGuire's town hall, that would be the first step forward. Then the board would have an agenda item where it could attach conditions, and some of the things I have in mind are exactly what you say regarding security, staff presence, etc. Nothing whatsoever that would in any way jeopardize funding for the project, but formal ratification by the board of conditions that are intended to address community concerns. I think that's appropriate. It's certainly not mutually exclusive with a series of community meetings, which I think was rolled out at the town hall. Community meetings can proceed on their own schedule. I think it'd probably be positive to maybe have that first additional community meeting after the town hall before the board agenda item. But it can be confirmed by reviewing the tape of the meeting. I do believe the board gave a direction for an agenda item. There's really no substitute for having formally adopted conditions. If they're not formally adopted, they can be changed quite easily administratively.
Chair Hashjack, at this point, my opinion is we can go back and look at the tape, or this board could give me direction today. If we go back and look at the tape, then we would come back at the next board meeting and have that discussion. It puts it out to December 8th. If this board wants to have a meeting on this project, I would say we would have to call a special board meeting. We have 2 meetings for the rest of this year, December 8th and December 15th. Those agendas are full. They will continue to grow. And so I would say that if this board chooses to have a special meeting around the Best Western project, that this board decide on a date and that we move forward with that. Additionally, we will have to work with the state to see what conditions Supervisor McCowan is talking about that he thinks need to come out in a board meeting. So however you would like to move forward, staff will take direction from the full board, however you would like to do this. But again, if you want to have this discussion on this project, I would suggest that you pick another date, that we schedule another meeting. I don't think we have time on the 8th or the 15th. And then if you think we can have a parallel process between the community meetings and the Board of Supervisors meeting, and that will not be duplicative, that's fine too. So Chair Hashjack, whatever this board chooses to do.
Well, I guess my feeling would be, looking at the process, it seems like we should have those community meetings first, and then we'll know what we're dealing with and what the concerns of the community are. So just putting, I think that if we had the board meeting before the community meetings, that doesn't really make sense as far as process. Any other comments from the board?
No.
Supervisor Jordan.
Just briefly, I did watch the meeting. I thought it went well, and thought maybe Megan sort of stole the show, which is pretty hard to do with Senator McGuire. The end of the year, it is challenging to schedule extra meetings. Fortunately, none of us are going anywhere. So if we have to, I guess we can. Maybe it could be on a different day other than a Tuesday, like a Monday. I don't know, maybe like the 14th of December prior to the Tuesday meeting on the 15th. And I do, my recollection is, and I think it'll come out in the tapes, that we did discuss the idea of some kind of conditions that the board would be voting on. And I think there's, I think it does provide some reassurance to the public that standards will be met.
Well, I guess the question is, do we want to hold off on that? Because, putting another meeting on staff at this point is a real burden right around. And can we have those community meetings first before it comes back to the board? So Not hearing anything. Why don't we go with that process? Okay.
Thank you, Chair Haschak.
Any further comments for the CEO report?
Mr. Chair, I do have a comment regarding the issue of meetings. And as we're all very aware with the impact of COVID, the extra burden on staff at all levels, it's been challenging to keep up with the normal business of the county. And, you know, we've seen numerous items delayed, including critical items. We do have an item that has been moving slowly through the process regarding a different cannabis ordinance, land use permitting system that would be a functional regulatory system. The board's given direction 4-1 in support of pursuing that. Staff has prepared a draft consistent with board direction. I've made comments to that draft.
Okay.
Hopefully staff will have a revised draft. Excuse me. Hopefully staff will have a revised draft available soon. I would suggest it would be appropriate to have a special meeting for that purpose. Thank you. And I do believe I have the right to call for a special meeting. We may not wish to have it. That's something we can discuss.
Okay. So if we're done with the CEO report, we will go on to supervisors' reports. It's 5:25. Let's see. So we'll start with supervisor reports. Supervisor Brown.
Thank you, Mr. Chair. I'll just briefly go through the meetings I've attended. If anyone has questions, I can answer them. We did have a general government standing committee. I'll let our chair, Supervisor Jurdy, report on that. I have been participating in the Cal OES calls, both on COVID and the wildfires, and was very glad that the August complex was approved by FEMA for assistance. I attended Inland Water and Power Commission meeting. Besides the normal reports, we had an update on the Potter Valley project. I also informed the commission that this board had approved the second amendment to the planning agreement. There was a Ukiah Valley Basin Groundwater Sustainability Agency meeting, my last as chair. And mainly it was updates on outreach and working group meetings that were held. And then there was discussion regarding updates to the monitoring network, discussion on the development of the groundwater sustainability plan chapters, and upcoming opportunities for review. Also, discussion regarding the future scenarios and collaboration with Sonoma Water. And so anyway, it was a good meeting. I have had the CSAC annual meeting, as well as you have had, Mr. Chair, and our CEO and others involved. But it opened up the first open session. We had Governor Newsom, and he was quite animated. He said he was in his office, and he said he had no staff there. But I enjoyed having him there. There were some, it was called a fireside conversation. And also he did highlight the work of counties, COVID and during the wildfires, and thanking everyone for all their involvement to help constituents throughout the state. I attended the Health and Human Services Policy Committee meeting. We had a presentation on First 5. We also had the Department of Healthcare Services and their new director, William Lightborg, talk to the committee. And we did make some changes to the policy platform. We reviewed it first, of course, and then also approved changes for the 2021 HHS priorities for the year. The next policy committee meeting was the Housing, Land Use, Transportation, and Policy Committee meeting, and that had much of the same changes for any of the platforms we have, also work plan. And we also discussed, we had Assembly member Cecilia Aguilar Curry came and spoke to us about what's next for housing and land use in 2021. Never heard her speak before. She was very informative. Then we did talk about our platform update and approved it. There was some language changes, but with the transportation part, there was discussion on surveys, speed surveys, how they're taken, what's all required through CHP in order for enforcement. We talked about also the tribal gaming compacts, the intergovernmental agreements, mitigation measures, and enforcement as far as payments that go to local government. And what's going to be next with the gaming compacts, because a number of them are up for review. Then I attended the Government Finance and Administration Policy Committee meeting. It's the same thing for updating the policy platform, and it was approved. Then we also talked about the 2021 priorities for the year. And also in each one of these committee meetings, we go over the year 2020 in review, which is always important to do, to see, what you did for the year and what staff was doing for you. And we did have at that meeting 2 speakers on the California's economy and local revenue outlook. And a lot of that was around COVID. California is recovering slower than across the nation. And our unemployment is very, very high. And I will say that anyone that wants to review all the information can go to the CSAC website and see what was in the packets. I attended the Administration of Justice Policy Committee, and they talked mostly about the implementation of the juvenile justice realignment. But we also had the chairperson and staff person to a new committee, state committee, and this is on revision of the penal code. I wasn't aware of that, but I'm sure the DA, public defender, sheriff, probation all were. They will have a report that will come out in January 2021. Their main focus was on the adult system, not juvenile. And for their first year, there was no discussion on any of the code that was passed by the legislature or by ballot measures. That may change for the coming year once they set their goals as to what they are going to review. So stay tuned. We updated the platform for that particular committee, and also talked about the priorities for the coming year. And the annual meeting will be continuing. Yesterday evening, I went to the Women's Leadership Forum business meeting virtually, and we discussed updating our bylaws, as well as elected 2 new co-chairs. And we celebrated the 100th anniversary of the 19th Amendment. And our CEO was in attendance. I don't know if any other staff also attended. But looking at the Women's Leadership Forum, which I helped form with Supervisor Susan Adams of Marin County and Supervisor Kathy Long of Ventura and Kim Van of Colusa County. It was a pretty proud moment for me. In the recent past, we had not had a woman officer, female officer, for a number of years. And I think in 116 years, there had only been maybe 3, perhaps 4 that had gone through the officers' chairs for CSAC. So my proudest moment was when I witnessed all the officers for that particular year were all women. So very proud moment. And CSAC will continue tomorrow and the next day, virtually. Thank you.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. Yesterday morning, seems like a long time ago, I attended virtually, of course, a meeting by the City of Ukiah and many community partners regarding a grant application to the California Natural Resources Agency for an urban greening grant to extend the rail trail an additional 1.8 miles to the south, which would take it out of City of Ukiah jurisdiction into unincorporated Mendocino County. One thing that the grant funders will be looking for is an agreement between the city and the county so that they're assured that there's no jurisdictional issue there. The new trail segment, of course, will have to remain dedicated to trail purposes for 25 years. And City of Ukiah will be providing additional information on what the nature of that agreement between the city and county will look like potentially. The county, of course, has been supportive of trail development. So I think this is rather a pro forma step that we'll be taking. It is a very competitive process. As often is the case, there are many more applicants than funds available, but the staff from the Natural Resources Agency ask many detailed questions, very good questions, and I believe that the city and the other partners had good answers to those questions. One area of uncertainty, the future of MCERA and who exactly controls the right-of-way. MCERA also met on Monday. Chair Haschek and I were both in attendance, and the board did give direction for MCERA to help provide information to the California Natural Resources Agency regarding the transition of the right-of-way and assurances that it absolutely is reserved for trail development. And as part of the MCERA meeting, we did take action, a number of steps towards furthering the transition of the right-of-way to smart control on the southern end where freight currently operates, and rail banking most of the northern line, north of the Mendocino County, Sonoma County line, and other steps necessary to effectuate the wind down of MCERA and looking forward to the Great Redwood Trail. And I also would renew my request that the board consider adding an additional meeting. We just heard the 2 remaining meeting dates are full, and I'm aware there's a number of items in the pipeline. I think although yes, it's a burden for staff, I think it's well justified to have 1 additional meeting before the end of the year. So I would hope the board would be willing to give that direction. We have a lot of critical issues at the county, and we can't keep deferring everything. Thank you.
Okay, Supervisor Jordy.
Well, again, I would support a 3rd meeting in December, and I think that the Monday before our last meeting of the year would make sense as an optional day. On the General Government Committee that Supervisor Brown mentioned, just 2 items that we discussed. We received a presentation from the Department of Transportation on their various contracts, reviewed those contracts, and the other main item was a revised, streamlined version of the county's legislative platform draft presented by Sarah Duquette, and we gave Supervisor Brown and myself gave a little bit of feedback, and it is in process to be brought back to the board for adoption for next year. And 2 other meetings of interest. Some folks on the coast that I meet with often once a month on housing issues. We had a special guest this month. Senator McGuire met us via Zoom, and he went through probably 6 different pieces of legislation that is under consideration in Sacramento or was recently passed to encourage more workforce housing. And we also asked some questions of him, and that was a great fun meeting. And then also, I'm sure Supervisor Williams would probably want to just briefly discuss the meeting West Company organized with other economic development agencies in the county, including the county Move 2030 meeting we had last week. Personally, I thought the information that we received from UC Davis was perhaps some of the at least newest information for me. So I thought it was a good meeting, and I'm sure Supervisor Williams, who welcomed everybody to that meeting, might have more to add.
Okay, Supervisor Williams.
I may, but first, Supervisor or Chair Haschak, is it okay if I give an update on the cannabis ad hoc?
Yeah.
Okay. So often we advocate for local control. Our cannabis cultivation ordinance has the appearance of local control, but in fact, this is an illusion. Annual state licensing is required in order to cultivate starting January 1st, 2022. Our county ordinance adds layers of additional hoops to an already extremely regulated industry, bringing cultivators no closer to state licensing. Nuisance continues to develop in an environment of licensing limbo. In almost all cases, the negative consequences of cultivation are the result of activity which does not meet licensing requirements. California Department of Food and Agriculture requires site-specific analysis for all cannabis farms. CDFA believes this is an unavoidable California Environmental Quality Act requirement. In many counties, local permitting generates documentation which can be shared with CDFA to shortcut otherwise redundant site-specific review. This is the show your work aspect of the multi-agency CEQA. Under our ordinance, it appears insufficient site-specific review is conducted, curtailing the possibility of sharing documentation to meet the state licensing requirements. Additional work products by the county would go beyond documentation of review performed for our permitting. Therefore, not a solution to reduce fulfilling CDFA site-specific requirements. Cultivators today are free to perform their own full CEQA analysis. They can submit this direct to CDFA, bypassing our county. It will likely cost tens of thousands and could take years for the state to process. In the meantime, continued cultivation might not be legal. CDFA terms this the nuclear option. They don't want to see it happen. Just because we don't want to see it happen, they don't have the staff to process it, just like we don't have the staff to process it. We're years behind. If we adopt Humboldt's model with staffing parity we'll move faster than our current rate, which is about 0, but it'll take more than a decade to process our backlog. We are struggling with one manifestation of Proposition 64. Jumping to a new ordinance, we might struggle with other manifestations. Many historic sites put before a discretionary review body could fail to secure approval. Proposition 64 and related regulations favor large commercial operations. Local policy alone cannot facilitate the licensing of small farms. Statewide, a working model has not been identified to transition legacy cultivation to the legal market at the scale of our pre-existing industry. I'm dedicated to the effort. We continue to work with our state partners. However, without state legislative remedy, legitimizing small historic cannabis farms might be a fantasy. So, Chair Haschak, would you like to add any words of encouragement?
Well, I was just going to add that we do have a meeting with CDFA this Thursday. We're still looking at trying to see what we can do. They're bringing in the Office of Research and Planning, which is a CEQA oversight or clearinghouse for the state, to see if they can have a new set of eyes on it. And so that's what I'd add to it.
And then on Supervisor Jordy's other point, West with Move 2030 under Una's direction has done an amazing job capturing a lot of community input on where the public wants our economy to go in the years ahead. And it has the makings of being a solid foundation for strategic planning that I hope the county can begin in January.
Okay, is that it, Supervisor Williams?
That's it.
Okay, just to add to what Supervisor Williams said about the cannabis ad hoc is that we did meet with Senator McGuire last week. We explained the issues to him. We're meeting with CDFA this Thursday. We met with lots of community stakeholders. So we are trying to we are working on it. And we, you know, right now it's like Supervisor McCowan would say, a peg and a square hole or whatever. So round peg, square hole. But there's got to be some kind of solution to it. So Senator McGuire had the town hall last night. The CMI, okay. And the 2x2 committee, I think that will be something we should start at the beginning of the new year. It was a great idea to work collaboratively with the city of Ukiah on this issue. And Megan Van Sant was really appreciated for her expertise and passion for this issue. So I've been attending the CSAC meetings, like Supervisor Brown said, the juvenile justice. There were a lot of talk about this realignment where the kids that we're sending to who are kind of the more serious offenders who are going to a state institution. I think we have about 3 out there in state institutions, that they will be coming back to Mendocino County. So we've got to figure out how to deal with them because they might need special care. So that was an issue. Let's see, Supervisor McCowan talked about MCERA. And I missed a meeting today of Senator McGuire doing continual work with the county and the US Cellular, trying to figure out the problems of cell coverage up in Coppola area. So I hope to get an update on that tomorrow. And I think that I will be talking with the clerk of the board and CEO about how to move forward with our agenda, because we do have issues with COVID and you know, staffing issues. So with that, thank you all and have a good evening. We'll adjourn the meeting at 5:48.
Thank you, staff.